day. We have a very packed schedule, so I'm excited to start it off. I want to welcome and also ask Carol Paquette and Peggy Simpson to come on.
Okay, let me try to help you with these guys. Okay, we got Carol. We got, how about you want Dick
Peggy.
Elkin?
Dick, yep. We'd like Dick Elkin, Peggy. Peggy, if you can start your video, that'd be great.
Okay, and let me get Peggy. Let me help Peggy there with ask to start video. And then Joel Shapiro.
Is Joel on?
Shapiro and
Yep.
Peter
Enstrom, if they're there. And Dick.
Okay, I asked Dick to come over. I think I gotta give him his video. And Shapiro. I don't see Peter Engstrom. But I don't.
That's okay. He may not be on yet.
Let's see. We got somebody raising their hand. Let me make sure that is not him. Okay. Janelle Ingram, is that somebody who you wanted?
No, that's okay.
Okay.
We'll start. Right. We'll start. I know time is of the essence. Okay. So one of the things that I wanted to just start off with is a reminder that the network does a lot of things for all the villages, and we encourage you to make a donation to help us further our mission and our goals to scale our movement. But this morning, besides making the pitch for a donation and do the ask like Betsy France encourages us to do, I'd like to turn it over to Peggy and Carol, who are going to talk about our board members. We want to thank 3 outgoing board members, and I'm going to have Carol start and talk about Dick Elkin.
Great, thanks, Barbara. Good morning, everyone. Happy to be here again. Glad that you're all joining us for the 3rd day of what I think has been a really successful conference, thanks to Barbara and the planning group. Well, where to start when we talk about Dick Elkin? Dick has been with the Village Movement for a very long time. He's a founder, director, and vice president, former vice president of Nauset Neighbors Village in Massachusetts. In 2013, at a very crucial time in the life of the network, he joined the advisory council while Capital Impact Partners and Beacon Hill Village had started the network as a joint venture. He advised that group and was very instrumental in the transition of the network from being a sponsored organization to being an independent self-governing body. And having come in on kind of the tail end of that transition, believe me, it was not easy. Dick was the first treasurer of the national network, and he's been on the board of directors since 2015. While he's been on the board, and actually prior to being on the board, he has done many things to promote the movement. I think many of you are very familiar with the Village 101 toolkit. It's sort of our basic reference Bible, if you will, for the villages, village formation. And Dick is the principal author of that document, which is really a monumental amount of work in putting all that together. He has been very active in the mentoring of new villages, and he's also been very proactive in advocating on behalf of villages in the state of Massachusetts. He has participated in grant applications and in other documentation that's important to the network. He also prepared this year the 2019 990 for the network, which again Anybody that does that knows that that's a lot of work. He was also very involved early on in the development of the Club Express Village application, which is now Run My Village. I don't know if many of you are aware that quite a few years ago, the network, when it was under Capital Impact Partners and Beacon Hill Village, contracted with Club Express to develop that application specifically for villages. And Dick, with his depth of knowledge of village operations, was very instrumental in providing guidance to that development. There are many other things I could say about Dick and all the work that he's done, but we have a few other people to recognize. I think we will greatly miss Dick on the board. He has really done yeoman service in behalf of the movement, and we hope he'll continue to stay involved. Thanks. Peggy?
Well, I want to say thanks to Dick also. Dick was on the board when I first went on the board, but another person who's made a real difference to the board is Peter Engstrom. And he's sort of been a gray eminence, like in a different way than Dick. He's one of our board members who's had a wealthy about how you organize a board, and we're all grateful to that, but as well of he's a good head in thinking out how you continue to organize a national movement or to use the network to foster the national movement. He's also just a wise head. You know, we'll be arguing something or other, you know, whether it's raising money or whether it's what you do about villages that are just, you know, springing up, but not necessarily part of us or part of anything. And he's been somebody who's pretty much of a good visionary in scoping that out and giving us some guidance on how to go forward. I remember one time when we were in St. Louis for one of our rare in-person board meetings, and he was in charge of our the blueprints, of shaping a blueprint for a policy that would be how we as a network would go forward. That includes lots of moving parts. As I said the other day about Mandy, you know, it's herding cats, because villages, it's true when they say that you've seen one village, you've seen one village. You know, we're not all operating the same. We don't have the same amount of stability or fragility. And so you can't just send down mandates from on high and say, here's what we as the network board have decided everybody should do. It doesn't work that way. As Barbara knows and Travis knows from calling people, or Carol knows from mentoring villages who are running into roadblocks or just want some extra insight. And Peter is not only a member of one of the early villages in Maryland, but he also commutes to Florida. He's virtually in Florida as much time as he is in Maryland. And that gives him a different look at how things are, to envision how a village movement in Florida can take place. So I think that he's one of the people who, when Barbara talks about scaling the movement, he's one of the people who knows the component parts of that, including how you fund it, you know, how you help other villages fund their village, and how you use mature villages to help fledgling villages in informal ways. And I think Peter has been one of our wise heads in that. So we're all grateful to you, and we don't expect you to go away. We expect you to answer the phone when we call. Thanks a lot.
Thank you. Thank you. Last but not least, I want to talk about Joel Shapira. Joel has worked in sales, business development, and large management roles for years. And you know, combined all three of these gentlemen, we're talking 18 years of service combined, 6 years on the board. Joel started with, you know, he was a vital growth facilitator. His focus has been on customer acquisition and strategic partnerships and development. And you're going to see a really great example of that at the end of the day today. Joel is our last presenter, and he and Hillary will tell you how we can scale this movement with the strategic partnerships. So we look forward to hearing from each of them. And I want to thank all of you, Dick, Peter, and Joel, and Mandy, for all your service and your tenure. We do appreciate everything. And I just want to say, one of the greatest gifts that we can have is your time. So thank you. Now I'm going to roll right into introducing our speaker for today, who is this morning a great friend, somebody I've gotten to know over the years, Bob Blancato. He is the president of Matz, Blancato and Associates, a government affairs and consulting firm in Washington, D.C. He's also the executive director of the National Association of Nutrition and Aging Services Programs. And is the national coordinator of the Elder Justice Coalition and the Defeat Malnutrition Today Coalition. He's also an adjunct professor, I just learned, with Virginia Tech. I may get that wrong. But Bob, I'm going to let you start. Welcome, welcome. Thank you again for just coming and saying yes.
Absolutely, Barbara. Nice to see you, even if it isn't in person, but thank you for the introduction. And whoever's moving the slides, I want to say thank you in advance because we have a lot of them. And before we move on to the first one, I'm very happy to be back here. I was happy to hear Carol from Arlington, Virginia, just now, and it's good to be here. So let's go to the first slide, and I'm going to say thank you for a reason. There was a lot of slides, a lot of information I'm going to give you this morning, and these slides will be available to you if you want them beyond today. So yes, I'm happy back, happy anniversary, happy 2 weeks before the election day, and I think Barbara has done a fabulous job. I mean, I've watched her grow, the organization grow, and this is the time you got to take a second and give special commendation to your leadership, because this is a very tough time to run an association. These are very challenging times. And the fact that you've had growth since last year is a testament to the concept of the movement, but the execution of your mission. And, I think the key now really with villages is where people are getting their services, especially in this pandemic, in their homes and in their communities. And all I can say is I know for a fact, living in Arlington, Virginia, how important the villages are there. So let's go to the next slide. And this is the issue at hand, which is the pandemic. I mean, this world has been transformed by the pandemic is probably an understatement. It is both, as we know, an economic and a healthcare crisis. We can all point to when it started, but we wish we could point to when it will end. And also what downstream issues we're going to have to confront as a nation. The Congress and the White House on a cooperative and a bipartisan basis did respond early in the pandemic, as the next slide will show, but where the arrow ends and the next slide is where the problem is now. So let's go to the next slide. And you can see the history of these COVID emergency bills that you've been hearing about, okay? Going back to January when the public health emergency was declared, moving into March with other activities around states of emergency. And then you begin to see the passage of legislation in March and in March again. But when you get to May, things stopped. Next slide, please. And, from the standpoint of aging funding for aging programs, we've done pretty well in that space with a lot of advocacy from your folks and from a lot of other people, beginning with $250 million in funding just for the nutrition programs in the Old Americans Act in the Family's First bill, the first bill, real bill that passed. And then you add another $1 billion to the Old Americans Act that came from the CARES Act. I see somebody saying there's an echo. I don't know if it's on my end. I apologize. I'm not sure.
I'm not hearing it, Bob.
Okay.
So go ahead.
Yeah, if you've anybody who has an echo, unless we can hear it, it's specific to you. So just log out and log back in again, and that may help it go away.
Okay. Thank you, Steve. And meant to say hello to you as well, Steve. Steve and I just did a program together a week or two ago, actually. So going back to the CARES Act, not only was a lot of money put into the Older Americans Act, but they gave what is very important in this program, total flexibility on where the funds could be spent. So if you needed more money for caregiver support versus, say, senior center support, you could have the flexibility to transfer the money around. But I think what's more important is how important advocacy has been and how important the value of the Older Americans Act programs have been in way that Congress has supported it in these bills. And the other important thing too is how they've increased the federal share of funding for Medicaid, which, as you see later in the slides, is very important as Medicaid has seen a tremendous increase in enrollment. Let's go to the next slide. These are some more specific numbers on what's contained in the CARES bill, the last major bill that was passed in Congress. So we talked about the nutrition programs, supportive services got an increase in funding, Native American programs, caregiver programs, elder abuse programs, and so on. But the key is this is additional money. This is emergency money that can be spent through September 30th of 2021. This is separate from their annual appropriation. This is only designed to address the emergency at hand. Let's go to the next slide and you'll see some other provisions that are included in the CARES Act that are important, including the extra money for food banks and commodities. And those of you in the villages know how food banks have had a tremendous increase in utilization. A special fund for hospitals responding to the coronavirus, and you know how hospitals have been stressed. Community health centers getting additional $1.3 billion. You know, and we'll come back and talk about telehealth later, but that is one of the tremendously positive outgrowths that happened from the coronavirus, which is the expanded use of telehealth across the board in this country. Additional money for low-income energy assistance program, and additional money for affordable housing and homelessness assistance. So let's go to the next slide and you'll see we run into the problem. Where is the next COVID bill? As we call it, COVID 4. You know, that's a day-by-day issue. In fact, when I started writing these slides a couple of days ago, I said, maybe I should just leave that one out until I know exactly where things are. And I guess the problem from a, from a policy standpoint is that, the first two bills were passed on a bipartisan basis with the House and the Senate and the White House working together in response to an emergency. But you know what? The pandemic isn't over, and neither is the need for more emergency funding. So if we go to the next slide, the House has responded with the passage of a bill called the Updated HEROES Act. And what they've done is, again, put $2.2 trillion in for relief funding across the board for many different programs. They maintain the extra money for the Older Americans Act in there. And we'll go to the next slide, and you'll see other provisions in the House passed Updated HEROES Act. Additional money for adult protective services, additional money for the long-term care ombudsman, additional money for long-term care facility staffing, and additional funding for forensic centers to detect elder abuse. So let's jump ahead 2 slides now, if we can. Okay, one more. There we go. Also in the House passed HEROES bill was continued flexibility for the Older Americans Act nutrition program. Let me explain what that means. Under the existing program for nutrition in the Older Americans Act, you must meet certain nutritional requirements for the meals that are served, 1/3 of the required dietary allowance. But when it became apparent that we were converting this program from a congregate program to an all home delivered meal program, and there was going to be a greater need for demand for food, it was felt that if we have the flexibility in removing that requirement, we can get more shelf-stable meals to older adults. And that's allowed a lot of new companies to come into the space to provide help in making sure that meals can be provided to older adults across the country. So getting rid of those waivers was a very important thing. The House bill has, and this next bullet, the $436 billion for state and local governments. That's very important. And it's one of the stumbling blocks between the House and the Senate right now, because living in the localities that you do, your counties and your cities are having trouble with their budgets. They need relief. Another provision that is very important is an increase in funding for the SNAP benefit, food stamp program benefit, the maximum benefit. Additional money for SNAP in general, and another $450 million for food banks. The additional unemployment payments through next January is in the House passed bill, another stumbling block between the House and the Senate. $15 billion to make sure the Postal Service doesn't collapse in the time right now that is most important for the Postal Service to be on its game. additional money for Indian Health Service, for this nursing home strike teams, and additional money for Section 202 housing, senior housing. But let's go to the next slide and you can see where the dilemma is. Okay, the Senate Majority Leader has said they will take up today or tomorrow, it's not just this week, today or tomorrow, a targeted COVID-19 relief bill for a vote. They tried this once before. It didn't even get to the point of taking a vote. And it will, mostly it's about replenishing the Paycheck Protection Program for small businesses. Maybe this time they might be able to pass the Senate, but there's no hope of this bill passing the House. And you don't have to be a genius to figure this part out. If you've got a bill of $500 billion and a bill of $2 trillion, there's a huge difference between those two to reconcile to come up with one bill. And meantime, the president keeps sending out tweets telling the Senate Republicans to either go big or go home. Okay, so who can figure this out? I wish I could, but let's go to the next slide. I'm going to try to use my crystal ball and say, is there any chance this bill passes before the election? Well, there's one other new development that came after I got these slides produced. Speaker Pelosi said on Sunday they got 40 hours to come up with an agreement. Okay, that 48 hours ends tonight. Okay, and I don't know. As I started this presentation, I didn't see anything that suggested they were that much closer to get there. But let's say they come to that agreement. All right, then it's possible that a emergency bill could pass. The Supreme Court nomination vote is coming up, and that will be taken on October 26th, giving them a couple of days to put a bill on the floor for a vote. But if it isn't before the election, if there is no emergency bill before the election, then for sure there will be one in a lame duck session for this reason. Going back to regular days of funding, okay? The federal fiscal year ends on September 30th. October 1st starts the new fiscal year. They had to pass a bill called a continuing resolution to keep the government funding. That only goes till December 11th. It means Congress has to come back after the election and take up an extension of the continuing resolution and possibly a COVID bill tied to that bill. I personally feel confident that a post-election emergency bill will go big, because if we have to wait till December and we haven't had a bill passed since May, you know what the conditions on the ground are like, how much deterioration there's been. So let's go to a more pleasant topic, I guess, something we do know about. The next slide, please. One of the positive developments of this year was when President Trump signed a 5-year reauthorization of the Older Americans Act into law. It provided a 35% increase in authorizations for all programs over the 5-year period. And it reaffirmed the key existing programs in the Act, but also looked ahead toward modernization with some important additions to the Older Americans Act. Next slide. For example, in some of the new provisions, we're adding for the first time malnutrition screening as part of nutrition screening within the broader routine health screening of disease prevention and health promotion services. 1 out of 2 older adults is at risk of malnutrition. We see an increase in food insecurity. That's a precursor to malnutrition. The Older Americans Act is recognizing this, and it also says reducing malnutrition is a stated objective of the nutrition program. The new Older Americans Act brings research, evaluation, and demonstration programs back into the Act after a long absence. It places a greater focus on social isolation by empowering local organizations to evaluate solutions for social isolation and bringing social isolation screening into health and supportive services. We need to do that. We need to understand this growing national issue in this country around social isolation. And finally, the bill would continue the falls prevention and chronic disease self-management program that's been in the Act for some time. Next slide. Now, this topic we all are familiar with. Villages, folks have been talking about this. The movement's been talking about this for some time. The whole notion of social determinants of health. And finally, in the Older Americans Act reauthorization, we're seeing the recognition of social determinants and addressing that issue in the Older Americans Act by emphasizing the connection between social determinants of health and social isolation. But I think where we have seen probably the greatest progress in addressing social determinants of health comes with what's going on in the Medicare Advantage program. And let's go to the next slide. Some new data that came out from the Centers for Medicare and Medicaid Services shows that the number of health plans under Medicare Advantage offering non-medical supplemental services increased from 499 in 2020 to 738 in 2021. This includes 1,943 counties. That's a significant increase. These can and do include things like in-home support services, adult day health, nutrition supports, home-based palliative care, caregiver support, and therapeutic massage. And the growth has been especially tied in this area among special needs plans. But if they continue to grow and leads to greater support for Medicare Advantage, don't be surprised if in a couple of years from now, they're offering it under traditional Medicare. So it ends up being more competitive. Let's go to the next slide. You know, I hope that the growth in these services is tied to better relationships between Medicare Advantage health plans and community-based groups or for-profit entities that are providing services such as nutrition. And to me, it argues for familiarizing villages to health plans to see if we can find some more synergy going forward in this area. And the next slide, there are a couple of other bills I want to bring to your attention on social determinants of health. These are new bills, and if you notice, they are, for the most part, bipartisan. And you know, it's a when you see bills introduced on topics like this, it's an indication that the issue is getting greater visibility in Washington and in front of Congress. And you know, I particularly call your attention to the Empower for Health Act, the training for health professionals to address social determinants of health. And you know, all these other things are intended to raise the profile of this issue. But you know, when we started this process, it was a bipartisan issue. We're noticing lately that it's starting to be less of a bipartisan issue, and I'd be very concerned if social determinants of health becomes a political issue going forward. Let's hope that's not the case. Let's go to the next slide. I mentioned this before about the growth of telehealth since the pandemic. You know, it's by necessity, it's clearly caused by the pandemic, but there has been a great significant growth in the list of telehealth services that Medicare will now reimburse. And just last week, new guidance was provided by the Centers for Medicare and Medicaid Services to help states expand telehealth and Medicaid. So you added 11 new services, bringing the total to 144 total new services are now covered by telehealth. And that's a good development. That's all been done through modifying regulations at the executive level. You're probably going to see that number of 144 go up because people are advocating for additional coverage. But then the question becomes one of, will they remain permanent after the pandemic is over? And you know, there's a tremendous amount of activity going on at all levels to keep these things permanent going forward, because it's going to take some time before you go back to the normal way of doing business, visiting doctors' offices and the like. And the administration recognized this early on and said they've made some of the changes in telehealth permanent for rural beneficiaries. Let's go to the next slide. But I think it's important to hear your perspective in two areas going forward. What services would be most important to make permanent from the standpoint of the villages? And how do we ensure better access for all to these services? You know, we've been talking about the digital divide for a long time in this country. And if there was ever an indication of where we see it now, it's in this area. It's wonderful to expand telehealth if you have the capacity to get telehealth. And I think what you're going to see is a corresponding issue of moving to expand broadband coverage as we also expand telehealth. I think there's a bipartisan degree of support for that, and it may end up in the next emergency bill if we're lucky. But we'd love to hear some information and some comments from you on this topic. And let's go to the next topic. It was one I spoke about last year when I came to you, a problem that is still going on across the country, which is elder abuse. And you know, the key to any good village, any good community is being safe. And so this year, the work has been to try to get the Elder Justice Act reauthorized. But there's been a newer urgency caused by that pandemic in the elder abuse space. The first, of course, which we're all too familiar with, is the tragedies in nursing homes where 40% of all COVID-19 deaths have occurred. And then, of course, the increase in the number of scams that are being perpetrated against vulnerable elder adults under the auspices of the pandemic. So let's go to the next slide, and you can see what's going on in this area in Washington. There have been a ton of nursing home reform bills introduced. But here again, just to show you the environment that we're in, something that we all are concerned about is a partisan issue now. You've got bills introduced that are only introduced by Democrats or only introduced by Republicans. And that's why you have a failure to move anything. Now, it's important to know that 4 of the 6 major pending bills do include a reauthorization of the Elder Justice Act. And these bills are authored by committee chairs. Senator Grassley, a Republican Finance Committee chair in the Senate. And then if you go to the next slide, Congressman Neal, who's the chairman of the House Ways and Means Committee, has the similar bill in there as well. And Senator Casey has an important bill in to strengthen the ability of nursing homes to get access to personal protective equipment and testing and things of that nature. So these are all important bills. And as you go to the next slide, you'll see while they do call for the renewal of the Elder Justice Act, they do it slightly differently. Okay, the Senate bill would renew funding for adult protective services, ombudsman, and forensic centers, and would add the Federal Emergency Management Agency to the Elder Justice Coordinating Council. And the Neal-Wyden bill would renew funding for adult protective services, ombudsman, but add long-term care staffing funding, more money for surveyors who go in and visit nursing homes and check on their conditions. But they both agree that we need to reauthorize the Elder Justice Act for 4 years. Okay, so we are still working in that space. And again, this could end up in an emergency bill as well. So let's go to the next slide. Another hot topic that we talked on last year was what's the situation for prescription drugs? There's no question that lowering prescription drug costs is still a hot policy and political issue. But as we approach the end of the session of Congress, it's not clear to me that any legislation is going to pass. The president has done a number of executive orders trying to make policy outside of Congress. 2 of the major ideas, including indexing US drug pricing to what other countries pay for drugs, and or importing drugs from Canada in order to pay their lower prices. And of course, for those of you who may have read about this, check your mail. Those of you on Medicare, not for the Publishers Clearinghouse, but for these new Medicare discount cards that are worth $200. But there's a little addition beyond what was in the slide, and that is there is a legal challenge to those Medicare discount cards. So they may never be seen before the election. Speaking of the election, let's go to the next slide and move into politics a little bit. So the election and what it might mean. And my goodness, what an election this will be. I mean, there's a lot of folks on this call that have been through many presidential elections. But this is the first one where both candidates are above the age of 70, showing that there's no age discrimination in politics. But ageism is certainly in there. And I'm not going to be partisan at all. I just know that both sides, but particularly one side, has been sending out messages about questioning age issues. And let's hope ageism does not creep into this campaign any further. And what's at stake in this election? Obviously, the White House and the Senate. The House is expected to remain Democratic, and their majority might even grow. My own personal predictions is I don't think this election is going to be that close, but it might be a long night before we know when it's over. And the Senate is particularly interesting because you've got a race in Arizona where the winner of that race is sworn in on November 30th versus January. And that could tighten the majority in the Senate even more before January. And I think the headline so far in this, right before the election, is the early voting numbers and how remarkable they are and what we're finding across the country in terms of interest in getting early voting done. So let's do a little speculating here on the next slide. Let's go to different sort of, potential scenarios, all right? Scenario 1, of course, is that you have the status quo. President Trump stays in office, Republicans control the Senate, Democrats control the House. The pandemic remains a front and center issue no matter who wins, okay? And how will we respond to it? And how do we get the vaccine ready for use in this country are your 2 top issues walking in. You will have, no matter who wins, the impact of the new majority on the Supreme Court. Okay, once the confirmation is done of Judge Barrett. If the president wins again, there will be a shakeup in his administration. No question about it. There always is when there is a change or a re-election. I think the most likely candidate to get booted is the Secretary of Health and Human Services. And then in a status quo situation, the deficit either becomes a front and center issue or it's completely ignored until the pandemic ends. And I don't know which one it's going to be. Let's go to the next slide. In terms of aging issues and a Trump second term, it's hard to really read because there hasn't been a lot of focus on aging issues so far in this campaign. The president made one move about a month ago when he suspended the payroll tax for a short period of time, which does help to fund Social Security and Medicare. And the question people ask, is this a one-time election year action, or does it suggest something more for these programs in a Trump second term? The president has said he's not going to touch either of them, but those of us who do this work, first thing we look at is the budgets that come out each year from the president. And does it have Medicare cuts as it has had before? We have to see. Of course, if the Affordable Care Act, which is front and center right now, is repealed in a Trump, and Trump is still the president, what replacement is going to be offered for those important Medicare provisions that were in the Affordable Care Act? Medicare Advantage has had a tremendous advantage in this administration that will continue in a second Trump term. Value-based care will continue to be favored in a second Trump administration. And Medicaid could go through some serious revamping in a second administration, including an effort to possibly block grants for the Medicaid program. So let's go to the next slide. And again, staying with a Trump second term, lowering healthcare costs is an issue for all ages. And that will be a focus in the second Trump term, with the headline within this being drug costs and how are they lowered? Is it through legislation? Is it executive order, or both? The Older Americans Act appears safe, but again, what's in the budget always needs to be reviewed. Telehealth expansion will continue and likely expand. And as in the first Trump administration, a second one would have a lot of surprises. In fact, maybe he would even make Mar-a-Lago into a village to join your movement. Let's go to the next slide. Scenario 2, as we call it, or the trifecta, which is not a horse racing term. It is, but not in this situation. Here we're talking about it. If the Democrats win all three, the House, the Senate, and the White House, what could we expect? Well, like scenario 1, the pandemic remains the top issue. And what do we do on the economic and health fronts? If there's no fourth emergency bill done before January, that will be bill number 1 in a Biden administration, with a heavy focus on funding for state and local government, a heavy investment in public health. And with the COVID-19 vaccine being front and center, the goal will have it be accessible, affordable, and have the confidence of the public. What else can we expect? The Affordable Care Act will be front and center if it's repealed. And if it's replaced, if it's repealed, it will be replaced. If it's retained, it will be broadened under a Biden administration. And there will be a strong effort to lower drug costs, with the centerpiece of a Biden administration having the government negotiate for drug costs. Next slide. Also in a Biden administration, you would have a stronger Medicaid with a stated position of working to end the waiting lists for home and community-based care under services under Medicaid. A block grant of Medicaid would be resisted very strongly. You can expect a new focus on Alzheimer's research in a Biden administration. Also, a build out of another stated position already announced in the campaign related to caregiving, including support for tax credits for family caregivers. The Older Americans Act would be safe and sound in a Biden administration, but you might expect their budget proposals to be bolder. Are we going to have to redo or reopen the 2020 census in a Biden administration? It's possible. But two cross-cutting areas I think you can look for in a Biden administration. One is health equity, and the second is a greater investment in population health and prevention. And more than likely, whatever a cabinet that he assembles would be interesting and diverse in a Biden administration. Now we go to the next slide. If there's a Senate flip, meaning that the Democrats take over, the impact will be felt in who becomes the majority leader, Senator Schumer of New York, and who becomes the chair of different committees and subcommittees, like the Finance Committee. Senator Wyden would become the chair there. The Senate Health, Education, and Labor Committee, Senator Patty Murray is possible there, or she could also get the Appropriations Committee in the Senate. Senator Casey of Pennsylvania will become the new chair of the Aging Committee, and other changes will happen as well. And in the House, which again is not expected to change its majority, the most interesting race, which will be decided before Thanksgiving, was who will be the chair of the House Appropriations Committee. There are 3 qualified women running: Rosa DeLauro, Marcy Kaptur, and Debbie Wasserman Schultz. My bet is that Rosa DeLauro wins and we'll see. So we come to what is the happy part of this presentation called conclusions, okay? And I think it's fair to say that this will be the year will be remembered for being one most people want to forget. This year has forced us to think and act differently. I gotta believe in the world we now find ourselves, there's a greater value and relevance for villages than ever before, because the world's becoming smaller and the importance of villages is becoming larger. Yet this importance only grows if there's a real commitment to having villages be as inclusive as they can in their composition. You know, COVID-19 has shown us that for older adults, where you live can impact your health. If services are not available, if housing is substandard, if access to care is restricted, that is not good. Next slide. So in the year ahead, it will be important for all community-based groups and national associations who represent them to confront some real-time issues. Is there equity in how you form your village? Is there equity in the rules governing your village? Do the services that are offered take into account different and economic and social conditions of those in the village? And from an advocacy standpoint are you standing tall on issues like more support for housing, transportation, closing the digital divide, ending food deserts and swamps, and the like? And the last slide, folks, is about advocacy. It is more important than ever. Who does it? How you do it? What are the strengths? They're all important. But the value of grassroots has always been the hallmark of effective advocacy, something you have built into your DNA. And the value of relationships starting at the local level is also effective for advocacy, and you have that as well. So, you know, it's doing what you do well and then doing more. That's the key to advocacy successes in the future. And we look forward to our continued relationship together. And I will leave as the last slide a resource page for things we could follow up on for some of the stuff that was covered. And with that, Barbara, I will turn it back, I guess, to you.
Hang
Well,
on, I'm here.
okay.
Or Steve, I don't know who gets it. Okay.
I'm here.
No problem.
I was typing away in the chat room. Bob, wow. Lots of great material.
Thank you.
I want to run through some of the questions that came through. Hang on 1 second, I'm having trouble.
My God, I see 76 things in the chat. That's
I
pretty
know
good.
it. We had a lot of chatter. And Steve is actually putting in your chat room, you know, the resources, the
Oh, good. Thank you.
NANASAP. We did have some questions, so I can go through them. So first one is, does the HEROES Act include funding for the CCC, the Community Care Corps?
You know, I saw that come across. I have to check, and I will be happy to check and respond back to you or whoever asked that question.
That was Wendy, I think.
Is that Wendy? Hello, Wendy, my friend. I'll check
Wendy,
on
you
that.
can, yeah.
I think so. My hunch tells me it was, but I'll double check and see.
Well, and to tag on it, you know, with the CARES Act, Title B, the funds, would that be something that maybe villages could apply for?
You talking about Title 3B, you mean?
Yeah,
In the Old Americans Act?
yeah.
Sure. I mean, what you have to do is the key to the whole thing with the Old Americans Act right now is the flexibility that's there. Okay, because you know, local areas are making determinations on what they consider to be important, and the key would be having to work with the existing aging network structure. In other words, if there's something that you want to get funding for, if it's a national thing, you're going to have to work directly with the Administration for Community Living. If it's a state thing, you go to your state unit on aging, and if it's a local program, then you need to deal with your area agencies on aging. And you know, I think the key would be what kind of existing relationships do you have, and what is it that you would try to get funding for? You know, because you got to understand, right now there is a tremendous amount of innovation going on day by day in communities across the country on how you do things like how you deliver meals. I mean, just take the nutrition program alone. If you have to make this conversion from people who are used to going to senior centers and adult daycare and other congregate sites to get their meals, and they can't do that, the one thing you have to be careful about, they become home delivered meal recipients, but you don't want them to become isolated any further because of that situation. So you now have programs out there doing wonderful telephone reassurances, telehealth reassurances, creating virtual lunches to get people back together again. So if you've got a unique idea, then, I would say there's a possibility of it, but it's all about having that relationship throughout the aging network to make it work.
That's great. A lot of our villagers are doing that. That's the only touch point a lot of our members in especially very rural areas have, is that phone connection, the so
Hey, Barb.
Yeah.
Evie has her hand raised.
I did see that. And so
Go
does Trish. Evie, do you want to come on and you can ask your question, then I'll go back to the Q&As.
Yep, I just gave her permission, so Evie. Start reading the next question, and then if Evie comes
Okay.
on, oh, there she is. Okay. Evie? You're on.
Nope.
You have
Okay.
two of us as Evie Horton. You need the Evie whose email is villages@vashoncenter.org.
Okay.
Okay.
we-
I'll address that later. Okay.
Yeah.
All right.
So let me go to the next question, Bob. Does participating in Medicare Advantage programs prevent going back to traditional Medicare if one's medical needs increase and get more complicated?
That's also a very good question. My recommendation is it doesn't necessarily, there are circumstances and time periods when you could make the transition between the two programs. I would recommend that you read, for the most current information, the Medicare and You handbook that just came out for 2021, which is accessible through the CMS website, CMS.gov. And they have a series of FAQs and references in there that talk exactly to that point. But since things change so rapidly in the whole structure of Medicare, it would pay to get the information directly from them. And so I would urge you to take a look at that and get that answer.
Awesome. Another one is, Bob, in your advocacy on PPE and testing for SNFs, skilled facilities, please make sure the home care and home health care providers also receive access to subsidized PPE.
I would totally agree. And that is part of the advocacy strategy. I mean, I think the fundamental question we have to ask ourselves is, how in the greatest country in the world do we have shortages of masks? Okay. I mean, we can't supply enough masks to people who need them, frontline people in all walks of life. Even folks delivering meals should have access to adequate PPE and testing. So yes, I think the situation right now is probably there's two things that have to happen. There's got to be more resources put into the next emergency funding bill on PPE and have it stretch across the gamut of who needs it. But secondly, the new president, hopefully, if there's a new president, I should say, to apply the Defense Production Act to put more of an emphasis on PPE using that law that they have at their disposal, which mandates production at a higher, faster rate than they've been doing so far. But yes, home care is clearly in the mix on this conversation.
This is a good question. It kind of, I've thought of this too. And I have a daughter-in-law that works for Children's Hospital, and telehealth, the insurance is just, some insurance companies cover it and some don't. The question is, why does telehealth have to be authorized? Shouldn't innovation that can improve access to medical services at a lower cost than traditional visits be automatically allowed?
Sure. I mean, the answer is yeah, of course.
Yeah.
I mean, there's an old saying that Yogi Berra used to say, my favorite philosopher, who said, if the world were perfect, how would you know anyway? See? But in the perfect world, yes, that would be automatic. And in fact, it's surprising how much excitement people have about the changes that the administration has made in relaxing the rules on reimbursement for telehealth services. I mean, this was, the pandemic may have accelerated the process, but there has been increasing amount of utilization of telehealth and telemedicine for the past couple of years. And it was starting to really pick up speed in rural America. But yes, it should be more automatic. I think what we need to do from an advocacy standpoint is examine those 144 services that are currently authorized. But again, it's only theoretically through the time of the pandemic. There's no reason that it should end when the pandemic does. I think what you got to do is where the utilization has increased and where there's a preference on the part of the consumer to have telehealth, we should keep that, make it permanent. But at the same time, like I said in my comments, you've got to address the access issue. Not everybody has the same access. We've got to address that. So let's hope that we're on the right track in that area. And, you know, we're all going to continue to work to get as much of it covered going forward.
You mentioned in one of the slides, and I saw it also, define value-based care.
Well, value-based care in the simplest thing is going back to a principle where you pay, you know, you don't pay for the volume of services, you pay for the outcomes, if you will. You're paid for, you know, how quickly you can get somebody in and out of a hospital, how fewer tests you have to take. You know, it's really more about the outcome side of the equation. Now, this administration and the Congress have two different approaches in defining what value-based care is. What I would recommend for people who want to learn more about that, it would be to go again to the Center for Medicare and Medicaid Services website, cms.gov, but also go to the Centers for Medicare and Medicaid Innovation, which is a unit of CMS that is developing new models of care, some built around value-based care, some built around other things. But again, these are public documents, they're available, and you can see where they're going and what they're about to announce a new round of innovations. But in essence, and value-based care, honestly, even though the administration is taking a lot of credit for it, it really sort of began with the Affordable Care Act, you know, in the changes in Medicare, because what the stories that people were talking about, getting those bills where they had these, you know, these tests that were on the bill they were supposed to pay, that they never had recollection of having the test ever done, you know, and they were paying for everything that was on the bill versus how quickly did you get the person better, which is really the way healthcare should be done.
We have a question. Somebody raised their hand. Annette Kelly, do you want to ask your question? Are you there? I unmuted you. No, you're still muted. Hang on.
I'm sorry, I did not raise my hand.
Oh,
hold on, Annette.
I'll unraise it. That's okay. So the next question we have, if people can afford to enroll in traditional Medicare and pay for a Medicare supplement, is this still the best to do versus enrolling in a Medicare Advantage program?
You know, I'm not in a position to give
question.
Yeah, I don't want to give advice like that because everybody's situation is different. It really all depends on what you think you need. You know, what you think both currently and what you might anticipate. You know, I mean, what people like about Medicare Advantage is the different kinds of different services that it covers, you know, and that's why a lot of the younger Medicare beneficiaries are signing up for Medicare Advantage, because it covers a lot more on the prevention side, if you will. But it is an individual decision. I think people really have to examine it very carefully. I will refer you back to the Medicare Handbook for 2021 that I really recommend anybody who's got a question like that should read that very carefully. You know, and if you have to consult with someone at the Centers for Medicare Services, or, you know, there's interest groups out there, Medicare Rights Center, the Center for Medicare Advocacy. You could speak to maybe some of those folks who could give you better advice. But it is a totally personal decision that I don't feel I want to necessarily weigh in on for you.
Right. Actually, Dan Ehrman, he had a question. I think it's appropriate. It's very interesting. What about scenario 3? A Biden-Harris win, but the Republicans retain control of the Senate.
Yeah, good point. Somebody's tracking me down here. I like that. Well, you know what? That becomes more interesting than you think, because I mean, that's still divided government, but it's divided in a different combination. It's 2/3, 1/3. 2/3 Democrats, meaning the House and the White House, and 1/3 the Senate. You know, if you focus on Biden's history, all right, even if it gets criticized by some of the younger folks in the Democratic Party, his history is working across the aisle. His history is being bipartisan. His history is having relations and having, you know, legislative accomplishments involving Republicans. And, you know, there are still a fair number of senior Republican members who would still be in the Senate if they were in the majority that he probably has working relationships with. So on the surface, it would appear, you know, that it would not be a horrible scenario. But the flip side of that is the Senate is now referred to as the place where all good ideas go to die. And that we don't, if that process were to continue, then we're just back to the gridlock that we've been dealing with for a number of years. So I would say, I'm glad you raised it. That's the best speculation I can give at the moment. But I'm happy to we could follow up with each other at a later point if you want.
Okay. My pal Eddie Rivas asks, any insights on who is guiding the Biden health team and aging portfolio policy development?
Eddie's my friend too,
I know.
my buddy. Eddie, I can't answer that question. I'll just tell you the answer is good people.
I love it.
He knows what I mean.
I
Good
know.
people, Eddie. Good people, some of whom we know. Okay, how's that?
Debbie De Palma asked, could the network, I guess this is to us, could the network send a monthly update to all the villages for their newsletters so that members can be better informed about issues, policy, legislation, and hopefully get active in advocacy and aging issues? Debbie, we do that a little bit. Travis is very good about doing the Google. Anything I come across, I'm posting on Facebook. Not a big Twitter person, but Travis is. And so we'll be a little bit more productive, I guess, and looking for those. As I mentioned in the chat room, Travis and I had a conversation with the FTC this week or last week, and they want to partner with us and get information about scams and information and advocacy. And so we'll be conducting, I think, quarterly webinars, and they're going to be distributing information via our website. They'll have similar portal that we have for AARP. So we're excited about that new partnership and information sharing, which is what we do most for our villages. So we'll take it to your point, and we'll definitely follow up. So I had another one in here. It's very good, Bob. It's a new village in developing. They just joined. They're in Calgary, Canada.
Huh.
And we have about, 6 villages up in Canada, Vancouver, but now Calgary. And he states we've become pretty complacent in Canada on healthcare, but our provincial government is now floating privatizing healthcare, the extent unknown, lots of resistance building up, some negative feelings about Americans, giving Americans our cheap drugs. Any comment? Have you heard anything? You know anything about it?
Not much. I mean, they were talking about privatizing their health system in Calgary and in the whole country of Canada. I'm not sure.
Barry, do you want to come on? I'd pull you over if you want to ask the question directly. Raise your hand. I'll find you.
Because while she comes on,
There he is.
Oh, okay.
Go ahead, Barry, you on? I just did it. You can unmute yourself. There you go.
Yeah, at the moment it's just in Alberta, it's being floated. We've got a fairly right-wing government that's come in, a conservative government. So I guess, obviously the pandemic is forcing budgets to really rethink everything.
Mm-hmm.
But there'll certainly be a lot of resistance to that.
Sure. I'm sure there would be. It's the same thing as you have the discussion going on here about Medicare for all. Yep. Because what's the big, the big rap against that by those who have problems with it is the ending of private insurance. Yep. Because that's would be one of the outgrowths. And so I think, we'll be interested to see how that discussion ends up. I don't see a situation here where we're going to see that happening anytime in the near future. The last time we talked about privatizing a big aging program was during George Bush's second administration when he wanted to privatize Social Security, and that didn't go very far. So yeah. Let's see how it plays out.
Thank you.
Thank you.
Well, I think that's the last of our questions. Anybody else have any other?
Never mind.
There's 2 more.
Yeah, but I like what I'm seeing on the chats too. The chats are good too. So.
Raised hand, Lynn, do you want to come on? Are you there, Lynn? No. Lynn?
Lynn,
Oh.
you need to unmute, Lynn.
We could do Rob too.
Yeah, let's do Rob.
Let's do a race to see who's going to be the first one to speak, Rob or Lynn.
I think Rob
Lynn
wins.
just, okay, Rob.
This is Rob in DC. I've worked in the federal government on promoting communications for public services and ended up running a grant program. And politics gets its nose under the tent quite a bit. And I'm just wondering, what are the chances that the Trump administration will leave us behind some poison pills, like abolish some stuff by executive order before they ride into the sunset, if they do, or push through a lot of grants for their favored people. And I certainly saw that when I was managing a grant program and managed to divert it. But can we expect some, let's say, December surprises from the Trump administration?
Well, I mean, I think your second point is probably the answer to that would be yes, but I don't think it's limited to, I mean, I think a lot of administrations probably done that near the end, getting grants and contracts sort of out the door quickly while they still had the ability to do so. But you got to remember, they tried one not too long ago dealing with the pandemic and, and trying to promote a positive spin on what was happening in response to the pandemic, a big PR contract that's now been held up. It's under tremendous review right now. And even the Secretary of HHS has said, we got to put a halt to this thing for a while and get a better look at it. Let's just say that the possibility does exist of things happening through executive order and other things of that nature. But again, the outcome of the election becomes important. I mean, a lame duck session technically will consist of the same people who are in Congress right now. Okay, so that means Republicans will still be in charge of the Senate. But I'll just say that there will be a lot of people looking at that very closely going forward. And the hope is that if something egregious were to happen, and I'm not saying it will or it won't, that whatever mechanism a new Congress might have to turn it around, or a new administration might have to turn it around, they would exercise it. But it's sort of a hypothetical question, but one that I think we all have on our mind a little bit.
Thanks.
Thanks, Rob. And Lynn just said she didn't have a question.
Okay. Yeah. Sorry about that. I found my unmute button.
No problem.
Just
Okay.
Can I make one suggestion, Barbara? If you go back to the very last slide with the resources, and if you want to put it up again, my email's at the very end of that thing. If people have anything more they want to fire my way, they can feel free to do that.
Travis, will you do that for me, please?
Sure,
Well,
I'll
he's
put it in
doing
the
that.
chat.
Okay, he's going to put it in the chat
There it
again,
is.
Bob. Yeah.
Okay, good. I see it right there. Great.
So I have two more questions as we wind down. Kathy asks, might we have Medicare paying for some home and community-based services someday?
Oh, absolutely. Absolutely. I mean, if you look at Medicaid for the moment, we, starting in 2013 or 2014, I forget the exact year, for the first time in history, Medicaid was paying more for home and community-based services than it was institutional care. Okay, that was a clear indication of what people's preferences were, and what Medicaid discovered was a more cost-effective way to do business. Okay, Medicare, more than likely, first of all, Medicare Advantage in effect is already reimbursing for some home and community-based services I mentioned in my slides. But if you characterize preventative care in that same context, there are more preventative benefits that have been added to Medicare in the last 10 or 15 years than there were in the previous 40 years of Medicare. So all the trends are pointing to that coverage issue. And I think it's just going to be a question of what Medicare reform bills get taken up in the new year. But the trend is moving toward, you got to remember, us boomers, are now eligible for Medicare, and boomers of today want a different Medicare than they had before. The old Medicare was, it was great when you got into a hospital, it covered you well. The new Medicare is about keeping you out of the hospital and adding prevention and other things to your portfolio, so to speak. So I think we're in that right trend, and I think it will continue.
That's a good answer. I like that. Any serious discussion progress on large healthcare providers or insurers investing big into telehealth devices and broadband expenses for consumers, since they can save money in the long run? That would be great.
Yeah, that would be great. I don't necessarily know if I have an answer on that, but I think I know how to get that answer, actually. And I will make an effort to do that. And if whoever asked that question, if you want to get to me with your contact information, I'll see if I can follow up.
Oh, good. Thank you. And last but not least, COVID-19 has exposed the problems with our traditional model of nursing home care. Do you agree that advocacy is needed to changing the systems that impact the physical environment and operations of nursing homes so they can be true homes for the people that live there? Great question, Kathy.
Totally good question. I mean, I probably spent as much time working in that space as anything I do. It has been, I think back to last July, I guess it was, July of 2019. And I was invited to testify before the Senate Finance Committee on a hearing that Senator Grassley was doing with Senator Wyden on a potential new Elder Justice Act and nursing home reforms. At that point, the one graphic example that was presented at that hearing, a witness who came a little before me, a woman from Iowa, where Senator Grassley's from, whose mother passed away at a nursing home from dehydration caused by almost a week's worth of neglect by the facility to her care. That facility had a 5-star rating under the Nursing Home Compare rating system of Centers for Medicare and Medicaid Services. Fast forward to April or so of this year, the home in Kirkland, Washington, where the spread began rapidly among the residents of COVID-19 spread occurred. That facility also was a 5-star rated nursing home under Nursing Home Compare. So right off the bat, what we have to do is do some fundamentally basic things. For example, if you're a nursing home that gets a 5-star rating in January, you don't get reevaluated again until the following January. So by June, you could be down to a 1-star. You need to audit that data on a regular basis to make sure the conditions are the same, number one. Number two, there's always the question of staffing. Staffing is critical. Okay, we need to do more, invest more in staffing, provide tax relief to get the right kind of people in the nursing homes. But at the same time, we need criminal background checks to keep the bad people out of these facilities. That was a program that was adopted in the Affordable Care Act. We need to continue it. And the one thing that we're really focused on is the whole question of infection control. Because there were many facilities that fell short long before the pandemic started. And then it was exacerbated by the pandemic. And so, for example, now the Agency for Healthcare Quality just gave out a contract to a program out in New Mexico called Project ECHO that will offer a infection learning network to all the nursing homes that apply. There could be as many as 10,000 nursing homes that get this learning network to improve the quality of care in those facilities. So the long answer to your short question is that the focus going forward is on the quality of care side of things. This pandemic has demonstrated what happens when you deregulate. Deregulate can cause death if you deregulate too much, if you don't follow existing rules, you don't enforce rules. These are things that we can all address in legislation, and they will address it. And maybe even some of it will get done before the year's over.
Well, thank you, Bob. This has been awesome. I hear so many kudos, and I've been telling people to email you directly. And they have some specific questions, which I know you're really great about responding. So thank you. And we thank you for coming on. Thank you for your wonderful donation. It kickstarted our donor drive. So we appreciate it. Happy to see you even long distance.
Nice to see you as well. Travis, thank you very much. Steve, thank you very much. And to your board and everyone, have a great rest of the conference.
Thanks, Bob. Bye now.
Bye-bye now.
So next I'm going to introduce our panel we have coming up. This is a great networking opportunity and a presentation for what we've all gone through, COVID-19. We have three great panelists, Andy Gaines, who is the Executive Director of Ashby Village in California. Good morning, Andy. Thanks for getting up early.
Good morning.
Wendy Zenker, she is the Executive Director of Arlington Neighborhood Village and the V2V Network board member. Welcome, Wendy. And then Elise Lenahan is the Executive Director of Mill City Commons. So we welcome the three of you. I'm going to turn it over to Andy, who's going to start us off.
Welcome, everyone. It's so delightful to see all of you. Well, kind of, sort of. What I see is 315 participants and a few of my co-presenters and others supporting this. So really delighted to be here with you at this national gathering. It's been a while and quite a different experience doing it virtually. But we're going to hope to have some fun for this next hour, which is kind of a casual discussion, meet and greet, eat your food. But Wendy and Elise and myself will be sharing some of our stories and orienting, giving our context for what this time of managing COVID-19 and shelter in place has been. I know for everyone and for this country, it's kind of, it's been like the rug pulled out further from underneath us, and it just continues to happen. All the different ways that we're forced to stay on our nimble toes and see what's happening in the world politically, environmentally, socially, health-wise, and continue doing what we do with the care and love that we do so well. So we'll be sharing a little bit of our stories and creating some opportunities for you to share and to have some conversation towards the end. So I'm going to begin. The format of this presentation will be, I'll just give, I'm just welcoming everyone. We're going to have some survey questions along the way, and then I'll speak a little bit about Ashby Village, where we were, how we responded to this, some opportunities, some challenges, and vision going forward. And then Wendy Zenker from Arlington Neighborhood Village will have a chance to share some of her story, and then Elise Linehan from Mill City Commons will share hers, and then we'll open it up to Q&A and hear some of your thoughts. So with that, I think I'll change the slide, and before we go on to, we can stay here, but anything, Wendy or Elise, that you would like to say in welcoming folks and orienting for our time together?
Andy, thanks. This is Wendy. I think we're ready to get started, but we do have some polling questions that we want to have Steve pull up periodically. So we'll need to tell Steve when to pull up those polling questions.
Okay, well, why don't we start with one just for the fun of it? So let's start with that first polling question. And if we're not taking you by surprise, let's see, is it coming up?
Yeah, well, just do you mind just reading? I got so many questions for you guys. I want to make sure I pull up the right one.
Sure. Okay. So I'm going to read slow so you can pull it up.
Oh, it's
so
okay.
the question for everyone who's participating is, what statement best describes your village operations since March of 2020? So let's all click.
So that's good. We have about 318, a little over 300 people participating. So give it a few minutes.
Yeah.
I usually wait till it gets to about 50% and then I'll share the results.
And you know, unfortunately, it doesn't let the host and the panelists vote. So we'll tell you.
Yep. It'll be, you guys can see it, but in a moment here, I'm gonna end the polling and share the results.
Okay, here we go. Okay, so status quo, not too many status quo, remained open. Remained open but working from home was the biggest, okay? Hybrid of the office, working from home, okay, great. So mostly we remained open but working from home, different sorts of hybrids in that. Okay, So the next question is, how has your village membership changed since COVID-19 began?
Okay, and this one I'm gonna let panelists vote. Sorry, I didn't click that switch.
No worries.
And we're almost there. There we go.
So mostly, same number of members. A few have diminished members, more members. So yeah, we're gonna, and then add a new. So there's a fair mix, and I think our stories will demonstrate some of that as well. And then we'll be interested to hear a little bit more. Great, so those are the polling questions we'll start with first. And so now we're gonna head over to Ashby Village. So delighted to be able to reshare where our village is at. Ashby Village, we launched in 2010. I've met many of you along the way. We've been celebrating our 10th anniversary, and that kind of is going to bring me to the story of our year. We currently, this number varies, but we started probably, yeah, during, I'll speak a little bit into it, but our numbers have varied considerably, because not only were we faced with this, we were at a very strong level of membership, and then COVID hit, and our new membership dropped off significantly. Our retaining members, renewing members continued pretty steadily. And that would have meant that our numbers were going down significantly. However, during that time, we had another transition that I'll speak about, which is merging with North Oakland Village. And so I'll take it from there. But we currently have about 400, actually when we made this, it was 420. We currently have about 409 members. And then our volunteer pool has not changed much. We've had a very active volunteering organization, and we continue to have just over 300 active volunteers. Very active in 2019, just did a lot of services, a lot of support, and a lot of activities. 594 events in a year. I mean, that's pretty, it's just every week there's many meetings, etc. And we have just over 4 paid staff. So that's a little bit about the organization as a whole. What I'll say in terms of context, in terms of this transition is, we were celebrating our 10th anniversary. We were midway. We launched in July of 2010. So we were gonna, in July of 2019, we kind of began the move towards recognizing our 10th anniversary, both reflecting and acknowledging, celebrating, but then also beginning to look towards the future. And there were a whole variety of different events that were planned, and we were progressing through what we called the 10 for 10 series. We had 10 major events when COVID hit. And so we had to cancel the first major event that we were on the fence about whether we hold it or not, was the first birthday celebration at the Claremont Hotel, which is a very elegant, beautiful hotel in our area, for our first centenarian birthday. And then it was for the over 90s members of our village. And there were about 30 over 90s members that were planning to attend. And it was scheduled, I believe, for mid-May. And so we were, kind of as COVID was hitting, we were on the fence, and we determined ultimately, obviously, as the shelter in place happened, to cancel that. And that was a big loss. But we did ultimately come through, and as I'll speak about our response here, we did have a really exciting celebration that I'll share. So initially what happened, we were all on the fence, and at some moment when the shelter in place happened, we immediately launched a COVID response team, which was gathering together about 20 different leaders from our village to really consider step by step how we were going to address this new reality, this new issue. And it was a very powerful, whereas as the shelter in place happened and people were required to go home, there was kind of this feeling of like, oh, do we stop? Does things just, the group stop meeting? And we kind of rallied ourselves and said, no, this is our time of really stepping in and taking charge and being really robust in the way that we're continuing our operations. We're continuing to look how to pivot, as the name of the workshop was called. We really got very active. We reached out to our community. We sent information letters about what was happening about COVID. We set up a site on our website on the homepage where people could click for further information. We started sending out regular updates. And then we also, well, I'll speak about it in the opportunities, but this is a little bit about our response. We, essentially did what everyone needed to do. We kind of, we did start working remotely, but we do have every, from then till now, periodically once a week, et cetera, my staff would go in and be the only person in the office, or, things were happening. We were kind of rotating back and forth to make sure things were moving well. So at the beginning, phase one, our initial response was to like figure out, okay, how can we stay connected? Calling tree. We're going to get our volunteers on the phone. And so we reached out, we sent out a note to our volunteers. Immediately, we had 30 volunteers who stepped forward, who were like excited to take on lists of 10 or 20 members to make calls out to. We distributed the names. And we started making calls every week to our members who were over 90 and every other week to all of our other members. And we would have a script that we would send out to to these volunteers that gave them a basic guideline of how to proceed the call. But it was really about making connection and touching people and asking them how they were and helping to guide and support them. We continued providing grocery delivery, medication delivery. Our staff do that, the medication delivery. Our remote tech support went way up. We started really getting in there, and it was I'll talk about it in the benefits, a real opportunity to get people online. And we kind of created a really robust pathway to our member support people who could help people with whatever crises or concerns or stuff that they were facing. So that was the first phase that was going for many months. As things, kind of started to ease up a little bit, and we were recognizing that our members were really needing essential transportation, we started, we figured out how to resume that. We contacted our insurer, we contacted the city, we kind of did a lot of analysis and negotiation, and ultimately created a strong waiver for our members and volunteers, which had protocols for how to respond, how to drive, all windows down, anyone who's sick, no rides, a whole variety of things. And I can send that out if people would like to see that, but it's been a valuable tool. We started providing 20, 30, 40 rides a month with that for our members, and our volunteers really stepped forward with that. The next phase is around companionship. We did continue to do outdoor services support if members were indoors. So if it was just the volunteers coming. And we're in the process, we've just launched our companionship for one-on-one meetings, 30 minutes outdoors, 6 feet apart or 10 feet apart. I'm not sure about that. And that's begun to come in place. And we're starting to look at our programs and services. Our outdoor walks are about to start with some agreements. Next slide, please. So we definitely saw this as a real time of opportunity. We really stepped in, as I mentioned, strong communications, and really kind of celebrating the connections we had built and the opportunities that this was providing for us to really feel our connections and our linkages. We spoke about that, we wrote about it, we started we saw it as a media opportunity. And given our 10th anniversary and our robust efforts to really cultivate this feeling of celebration and of this important moment, we were really ready, and we started sending out to different media outlets, press releases, had a few different things published, which were talking about the first line of services we were providing. I was called by the Commonwealth Club of California to be part of a presentation that was being given, and it was in the first weeks after COVID, after the beginning, and it was, I was going to send that out, but anyway, I could also include somewhere, I just lost myself, a link to the Commonwealth Club presentation that was really, again, an opportunity to share how we as villages were stepping forward in this time amidst our challenges, but like really using it as an opportunity to build upon the strong connections we had built. So we had again, rapid uptick in our online usage. Our tech team became very active in supporting every one of our members who was having issues or challenges with Zoom to get informed about it. We had several Zoom trainings and started leading our events, and it's been a real robust kind of increase in our number of participants in events, because people who are not necessarily even part of the village can come in, and we're inviting that. It was also an opportunity to create new partnerships. We, in recognizing that our members might have an increasing level of need to, the Right Institute is through the UC Berkeley, and it's a training organization for counselors, community counselors and people to support people with mental health issues. And so we created a partnership, which we had talked about for many years, but they stepped in and were really ready because they had lost their some of their ability to serve the clients that they had. And so now we have a robust schedule where we have assigned, we basically will refer members of Ashby Village to the Right Institute who are looking for counseling and support, and they will take them on as ongoing clients. The PPP, we did apply for payroll protection monies and did receive that, and it has, although it hasn't been relieved yet because that process hasn't been completed, we did get about, I think it was $50,000 to $60,000 to support our continued payroll, and we have not decreased our staff at all. We have continued our staff at full level, 4 point some odd FTE, and that money is allowing us to balance our budget in this coming year. During that time, as I mentioned, we had a merger with North Oakland Village, and that was a big, it was an opportunity that had been out there for a while because we're located very close to where North Oakland Village, there's some overlap in our areas, and it just felt like Ashby Village had grown, significantly, had staff people, and North Oakland Village was a strong, committed village, but had really been wrestling to get any strong semblance of ground. And so in joining our village, and this goes back to the numbers that I'm talking about, they had 45 members, which joined our village. And so even though we've lost a number of members, we've maintained a similar level of membership, and we're looking at how we're going to be building our new membership going forward. Finally, we actually, and it was related to COVID, but it's more about the George Floyd and all the social issues that have come to the fore. This has been a real opportunity for us to redirect energy and attention to our diversity, equity, and inclusion initiative. We've hired a consultant through June of next year, and it is the most robust effort, I feel like, of our second decade to really look at how we, and to very tangibly address how we as a village are going to work towards greater inclusion and to serving a broader audience. And so I'll talk about that more another time. SIP challenges, I'm going to breeze through this so I can leave time for my guests, my other partners. So maintaining membership numbers, as I've mentioned. Keeping volunteers engaged. We have so many volunteers and they're ready and interested, but there's limited opportunities. So we are doing a lot of virtual stuff, but I do feel like that's a way we continue to look at how can we engage and utilize our volunteers to serve our membership, and do we pivot further and serve some larger community issues. Finally, this was a simple thing at the time. We were looking at, like, how can we how can we use our Zoom meetings as an opportunity to fundraise? And there was no simple pathway to that. We have identified a tool that you can use for donations during Zoom, and we're using the chat for that. But that was something that was something that we were working on. Next slide. And I think I'm gonna, with that, take a breath. In the past, I went at the village conferences. I also led some movement activities. So let's all take a moment. Let's stretch out for a second. I probably need it the most, but we've all been on this for several hours, and it's a good moment to take a breath so we can pass it over to Wendy from Arlington Neighborhood Village to continue your COVID response journey.
Thanks very much, Andy. I think something to share with the audience. It's one thing to be a participant in the conference. It's another to be a panelist. As a participant, you're aware of all the chatter that's going on, and you can engage with the audience. As a panelist, all of a sudden you're in this little isolated world of only seeing the slides and not being able to see conversation that may be taking place in chat. So please do know that we intend to get into chat and engagement and answer questions after the three of us have had an opportunity to just briefly share what our journey has been this year. Steve, if you're able, we'd like to bring up 2 more polling questions now. And again, these polling questions are as much to inform our audience about who's on the call and what are their circumstances. But Steve, we'd like to do the question on, do you have an adequate number of volunteers to fill your current request for services? So it's a simple question. And we're not necessarily talking about 100% of your service requests, but essentially the same percentage fulfillment that you would have done in years past. So if you could vote on that. Good, that's great. 82% are responding yes to that. That's wonderful. We're going to talk about the second volunteer question right now, which is again, just a simple one. Are you currently onboarding new volunteers in your village? And I know for many of us, that may be onboarding new volunteers through Zoom or some other online service. Again, a good response, not quite as many as the previous question, but 75% are engaging new volunteers. So with that, let me just quickly describe Arlington Neighborhood Village for you. And then from that description, go into a little bit of how we pivoted for COVID and what our challenges and opportunities are. Arlington is a suburb of Washington, D.C. We have at this point, again, much like Andy, it's amazing how things move so quickly. At the time we did this, we had 270 members. We currently have 290 members. But part of that is what I'll explain to you in terms of how we pivoted. We have essentially a paid membership. Full members get all services. Associate members are supporting the village, and much of their contribution is tax deductible. And then we also have members who receive financial aid. We have a good financial aid fund for the village that pays 80% of the membership fee for lower income seniors. At the beginning of the year, we had 35 members receiving support from our financial aid fund. And going forward, we've doubled and tripled that number with the way that we've pivoted. Like, again, many of our villages, we have a large number of volunteers. A good portion of those are what we refer to as our management volunteers. They do everything to help run the village in all of its different aspects. And we have 150 or more drivers. And again, that's a pre-COVID number. The number of drivers we have today is much smaller, but this just gives you a sense of who we were before COVID. And again, in 2019, we fulfilled 2,100 service requests, 2/3 of those transportation. Events that we conducted, we had about 5,000 people participating in those events. And if you look at the makeup of our village, we have 2 part-time paid staff, an executive director and a member services manager. We also have very part-time consultants. One is a volunteer coordinator and another a care manager. But both of those people are the volunteer coordinator is 10 hours a week. So that gives you a sense of who we are as Arlington Neighborhood Village. But then much like Andy, the question is, how did we respond to COVID-19? And I know that here in Arlington, the words were pivoted and retooling. Those seem to be our buzzwords. But for the most part, we continued our direct service operations. For us, COVID sort of changed the world March 14th. That was the day we decided to cancel our social events. Nothing quite as big as Andy's gala, but our falls prevention exercise classes, our in-person coffee and conversations. That midweek in March is when we decided that we were going to put all of those items on hiatus. And we actually did it before the governor's stay-at-home order took place here in Virginia. We just felt with the population that we were serving, the safer mode was to shut down in-person events. During that period, March through June, of course, everything turned to errands. All of the shopping trips to the grocery store became contactless errands. The medical appointments our folks had turned into telehealth. We did see it as an opportunity for us to start a new phone a member program. This is something we had wanted to do, but it was on a back burner. COVID brought it to the forefront. And we had, 75 volunteers raise their hands and say that they wanted to make regular phone calls to all of our members. So much like Andy, we started out with an initial script, but after that, we left it to the volunteer and the member to both agree to a schedule and agree to how often and how frequently they wanted to talk. Part of that phone a member program was if a member needed something and their phone volunteer could help them with it, then we asked that phone volunteer to take care of it directly rather than bringing it into the office as a service request which needed to be fulfilled. So that was pretty successful for those spring months. But another important thing that we did in that time period was we decided to waive our membership fee so that we could offer services to at-risk, in need, essentially lower income Arlington seniors. And again, when we wrote this slide deck, initially I had 50 of those members. Today I have 66 temporary members. And that was simply, in one sense, it was an incredibly easy decision. We had older adults in our community that needed help. And there were lots of individuals who were stepping up in local neighborhoods saying, I can help. We have a next door program and everyone was saying, what can I do to help my older neighbors? But we felt we had a program that was important in terms of safety, that our volunteers had been vetted, they'd been trained, and they knew how to share and respond to senior needs. So we decided that it was important that if there were at-risk, low-income seniors in Arlington who needed help, our organization was going to step up and help them. Now that, in reality, also became an incredibly stronger partnership with our area agency on aging, with the Arlington Food Assistance Center, which is our food bank, and with the Arlington Partnership for Affordable Housing. All three of those organizations were making referrals to Arlington Neighborhood Village, asking if we could help these people and help them essentially with errands. People who couldn't go to the food bank to get their food, could we have a volunteer who would go to the food bank, pick it up, and deliver it to the senior living at home? Our answer to that was absolutely yes. We wanted to do it and we wanted to help these folks and bring them into our organization as temporary members. We called it temporary. As I said, it started in March. Our board has said we're extending these temporary members certainly through the end of this year, and our plans for next year are something that I'll talk about as we get further into this presentation. Again, in terms of our normal processing, during the initial period, we weren't processing renewals. It seemed difficult to go out to people and ask them to re-up when we weren't necessarily providing the full set of services we had done in prior years. But starting in late May, early June, we pulled up and started processing our backlog of renewals. One of the decisions, again, we made was to offer a 15-month membership renewal option versus the 12-month. That, of course, is getting a strong response from our members. For the most part, we're seeing very good renewal numbers, much as we've seen in years past. Most of those people are indeed taking the 15-month option. What that means, of course, will be a budget hit for us in the coming year. Again, in terms of operations, in May, we resumed events. We started training new volunteers over Zoom. In July, we have a limited number of outside events. Again, that's following all social protocols of wearing masks and social distancing, but our bocce group started to get together. Again, we've got some pop-up picnics in the park. We have a happy hour group, some of which meet in person, others by Zoom, but we started a limited number of outside events. We also saw transportation requests start to tick up. People who hadn't gone to the doctor, hadn't gotten lab work, all of a sudden those needs started to come up. We permitted home chores that were related to health and wellness to start up again in August. And we decided to start welcoming new members again via Zoom. Normally we would have done a home interview. We decided that we could do interviews outside on a porch or patio, or if someone was living in an apartment, we could welcome them via Zoom. So we've started processing new members in the last few months. Why do we see, what do we see going forward as, what were the opportunities and successes we saw in the last couple of months? One comment came from one of our board members who said that our village was all of a sudden seen as essential to the community and not just nice to have. And I think that that speaks both to our ability to serve older adults, but also the work that we did to waive our membership fee to welcome in those temporary members. We've become an important part of the social safety net here in our community. And that has been observed not again just by our board members and by people who work closely with the village, including our volunteers who have stepped up and love doing this work, but also partnerships with other senior serving organizations within our community. And again, especially something like our Department of Human Services and our area agency on aging. The other opportunity and success is that this indeed put meat on the bones of our board goal to increase the diversity of membership. And that's to increase diversity on every scale, socioeconomic diversity, racial diversity, geographical diversity. These are absolutely goals that we had, that we were working hard to achieve, but the opportunity to have these strong partnerships and to respond to the COVID pandemic absolutely supported our board goals and as I said, made it real to people. One of the things we've seen as a result of this, and this was a question that was in the chat box related to for Bob Blancato, is how do we pay for this? And what we've seen is very strong funder and donor support for the efforts that we've made to waive our membership fee and to welcome in these temporary members. Funder support in terms of our community foundation provided rapid response grants, and we received one of those. And donor support from our regular longtime donors who would read about the work that we were doing in our newsletter or quarterly documents and would respond and say, thank you so much for what you're doing and the help that you're giving to everyone who's living in Arlington. So we saw donations come in as a result of our work, and we saw funders respond to that work. What are our challenges going forward? Well, again, in a sense, much like Andy, we were on a roll at the beginning of the year. We were, we've been in business we've celebrated our 5th year anniversary last May. We were doing an incredible job on marketing and outreach. In January and February of this year, we were welcoming 10 new members in each of those months and had every reason to think that that kind of growth was going to continue throughout the year. Then COVID happened. So our challenges going forward are how do we resume those active marketing and outreach to grow membership at all levels. Another challenge, raising funds for 2021. Again, like Andy, we received a a Payroll Protection Act loan in this year. We got about $15,000, but that money was really critical to balancing our budget. Because as you can imagine, expenses went down with respect to COVID. Our income dropped a little bit, but the PPE loan, helped to make us whole for this year. But now we have a challenge going into 2021. We want to continue to support all of the temporary members that we have. We want to convert them to full membership, but that for the most part speaks to growing our financial aid fund and growing that fund considerably, almost doubling it for sure, maybe doubling it plus. So we are, for example, undertaking a financial aid fund campaign this fall. We expect to launch it in a day or two, but we're really focusing on our donations between now and the end of the year to be restricted to our financial aid fund for 2021. We are also applying for grants to support our financial aid fund in 2021. We've already submitted one grant. We've got 2 more that are due at the end of this month. Challenges, we're continuing our volunteer recruitment and engagement. We certainly have many of our longtime volunteers who put themselves on hiatus, but we're lucky in that we have new volunteers that are coming on board every month. Those new volunteers are ready to start serving right away. Better tech training for our members. We've got people on Zoom. We've got demo classes that we do once a week to get people comfortable on Zoom. But most of our members, especially those that are 75 years and older, are not comfortable on technology. So we've got to do a lot more to get them comfortable on technology. Because one of the things we know is that some of these stay-at-home behaviors are going to become more permanent. Just when there's a vaccine or when people feel that we have a better response to COVID, it doesn't matter. Stay-at-home behaviors, I think, are going to become more built in to people's world. And what we're also learning is that some of our increasingly frail members need more services and support. But I want to stop now and turn this over to Elise so that she can talk about Mill City Commons and some of the changes that they're making. Elise?
Great. Thank you very much, Andy and Wendy. We are going in order today, not only of the most senior EDs for the villages, but also the warmest to the coldest, where we had flurries yesterday in Minneapolis, Minnesota, and 32 degrees today. So we're wishing we had a little warmer weather like Andy and Wendy, but I will start by asking Steve to put up the polling question of how has participation in your programming changed since COVID-19 began? Okay, great. So it looks like the largest level is decreased, so 45% decreased, and then about 55% has either stayed the same or increased. So that's good information to have. And then the last question that we wanted to poll on is, when do you expect operations to return to normal within your community? Okay, I think we all share, 49% share the same idea that it's too unknown to hazard a guess. And we have 23% looking at December 31st of end of next year and 11% beyond the end of next year. So I think we're of the same mindset that it's too unknown to hazard a guess. So that looks like the majority. So what I'd like to do now is introduce to you Mill City Commons, which, and then follow the same format that Andy and Wendy followed in their presentation. And Mill City Commons is a village within the city of Minneapolis, Minnesota. The most of our members live along the downtown riverfront in Minneapolis, and some members live around the city as well. And our current, we started the year, Mill City Commons was formed in 2008, so it's 12 years old. In January of this year, we started the year with 216 members, and currently we have 217 members. So we have stayed pretty much the same in terms of membership. Of that membership, 30% of our members are single members. And currently we have 5 trial members and 8 legacy members. Our Mill City Commons has its foundation in a rich calendar of programming and events. And we also have member volunteers, but our numbers are not as large as Andy and Wendy's. We have 40 member volunteers that provide rides and meals and visits if needed, but that's on a request basis. As I said, our foundation is on programs and events. And in 2019, we had 255 registered programs and 144 events. So close to 400 programs and events, and a total attendance of 6,000 members to those events. Right now, we have 3 part-time staff. And the business and service administrator and myself are working part-time in the office and part-time at home. And our programs and events manager is working exclusively at home. Our 3 part-time staff equate to about 1.75 full-time equivalents. So our response to COVID-19, well, for one, I had been with Mill City Commons for 1 month when COVID started. So it was definitely a change. We pivoted immediately to using Zoom programming. So our stay-at-home order came through March 15th, and we had our first Zoom program scheduled March 18th. Our motto has been through this period, connection, not infection. And we worked very hard immediately to get our members to adopt Zoom. We used one-on-one trainings, online guides, and videos to do so, as well as our tech support also helped one-on-one. So our boomers quickly became Zoomers, and all of our programs and social events were converted to Zoom. The only exception would have been our walking programs, and those we put on suspended until the summer, and birding programs. But all ongoing programs and social events were converted to Zoom, and our program committee, which doubled down on creating a calendar that was curated to provide a wider array of programs to attract more members and get more participation. The group also brainstormed new ideas. With the tragic death of George Floyd, we added a large selection of programming around racial justice and equity, as well as added many member-led programs that have been extremely successful in creating interest in Mill City Commons. A couple of those programs, just to mention, would be a bi-monthly program that we have with Dr. Michael Brennan, who is a member and retired Mayo Clinic doctor. He has graciously been studying COVID-19 and providing information to our membership in regards to updates on COVID-19, as well as answering questions with the goal of maintaining health and wellness for the membership. And that's been a very well-attended program. We added monthly racial justice discussions, and those programs are programs that are done in breakout rooms, so small group chats. We added a program called Tell Me a Story, so members could start to get to know each other better, and 3 members shared 10 to 15 minute stories in an evening and then have question and answers, and that's been very well received. We added a very interactive program called Women Who Make a Difference, profiling women within the community, and again, using the breakout sessions to really get interaction and more intimate social conversations going. All of the programs have really had excellent participation. And just to give you an idea of the success, we increased our program registration since COVID by 50%. And the number of members that are going to 25 or more programs a month has tripled. So programming has been our focus, but in addition, our goal was to really ensure that members felt that even though we were virtual, we were continuing to build engagement, community, and connection. We did, as Andy said, surveyed our can we back up, Steve, just to the slide before? Oh, yeah. We did a Pandemic Pals program where we had members calling members that we had matched, and over 90% of the members got a call, and then they kept the calls going for a 3 months time period. And that was very successful in creating what felt like social interaction. In order to maintain our membership, we added 3-month trial memberships for $100. And then as Wendy and Andy did, we applied for the payroll protection program. We received about $21,000 and we have had it forgiven. So we can move to the next slide. So our successes, last month, we have used a lot of surveys, and last month we surveyed the group to see how their input looked regarding virtual programming, and over 98% of our members had a favorable response on their overall experience with virtual programming. They felt it lessened their social isolation and favorably impacted their quality of life. In addition, with the intensification of programs, over 50% of our members increased their participation in events. So that's been very successful. And the COVID-19 updates were found extremely helpful in maintaining personal health and well-being by over 90% of our participants. Our trial memberships have also been our largest recruitment effort. We had 10 new trial members in May to August, and 6 of those converted. And now we have 5 trial members for our second trial membership that's running September through November. And so let's talk about our ongoing challenges as we move forward. Similar to Andy and Wendy, we're looking at creative ways to recruit new members. We have the same feeling as the poll. We don't know when this will be over, and we think we're going to be continuing to have to communicate online, and we're looking for creative ways to get interest and keep new members engaged without personal social connection. In addition, we're really looking at our messaging to make sure our value proposition is a strong message to members and really supports our renewals and annual giving. Another opportunity we have is to be looking at how we can use Zoom to combat Zoom fatigue. We're really pushing all of our speakers to be using the tools available to Zoom, and we're looking at ways to create different types of programming, whether it's panel programming, interviews, entertainment, using the breakout function. We're really trying to push to take advantage of keeping that fresh for the upcoming winter months. And the last thing that we did is to really keep the connections going. We took a look at our entire membership and created segments. And with those segments, we are working to create a connection calendar. So every month, each of those segments get special connection and interaction from staff as well as other members. And that we're excited to be pursuing for the next year. So with that, I will turn it back to, or I guess we'll turn back to look at questions and answers. And I don't know, Andy, do you want to?
I think it's Barbara's gonna.
Yeah, we can, here, I can, let's see, Richard Weiner says, for medication and grocery delivery, how do you safely handle the exchange of money to pay for these items?
Great question. my belief, and I'm not involved in the nitty gritty of it. So, but my belief is that we are, the volunteer is contacting the member, informing them how much money was spent, and they put it in an envelope outside in their mailbox or outside their door. And when we do a distance exchange, at least 6 feet, but there's some way that's my understanding.
So we have three questions, Andy, that pertain, 2 or 3, maybe 4, on your waivers. Can you discuss, briefly your waivers, the reluctance to sign a waiver, and actually why a waiver?
Yeah. So what I will say is that the biggest question about this was how to ensure that we were protecting the organization from any concerns about the way we've protected our members and volunteers, but really to step in to ensure that we're protecting our members and volunteers. So you could have agreements, understandings, but unless someone has really put their name on it and read it and signed it, it's much less apt to be followed. So what we did, actually, we had never done this before, but we got a subscription to DocuSign. And so now we actually have the waivers for most people. Now, there are some that we will email it to them, or we'll figure out how to get a hard copy signed. But for most of our members, we did institute DocuSign, so they could review the document, sign it there, and that was it. And we had members and volunteers do that. Yeah, I think it was, and what it spells out is really the understandings of the cautions that people are taking to ensure that they are using services that are appropriate for them at their level of health, and that, to protect our volunteers, to ensure that they're also being held responsible for their cars. So the waivers really detail out a bunch of other stuff. I spoke about a couple things, but we do ask our volunteers to sanitize their vehicles before and after a volunteer comes in, the wearing of masks, the opening of the windows. Yeah, and there's a lot more detail. So
I'm only going to step in for a second and offer an alternative. And only to note that, and we don't require a written waiver ourselves. So I think this is something that different villages are approaching in a variety of ways. From our perspective, we talked to our insurance broker, and we may be one of the lucky people who has what he referred to as, we don't have an infectious disease exclusion. So it's a sort of negative way of talking about it. But in terms of a legal protection, we felt that we had that for those purposes. And of course, we do all the other things that Andy talks about. Wear masks, clean your vehicle, keep the windows open. But we don't go so far as to require people to write and sign a waiver with respect to that. And I only offer that as for people to see there's a range of ways of approaching giving rides.
And we've done the same thing as you, Wendy. At Mill City Commons, we've done the same thing that you've done. We don't have an actual waiver, but we have a list of protocols that need to be followed.
It's really interesting. The chatter's great. And if you have suggestions, like John Ryder just said, if you have a way to pay for a, prescription, or if a volunteer is picking up something, or chatter about waivers, put it in there, because we're capturing all the chatter, and people will look at this afterwards and say, they may want to follow up with you directly, other villages. So keep that in mind and keep the chatter going. I'm going to lump together a couple of questions pertaining to Zoom and technology and programs. We've had a couple of, like for Andy, we had members who have older computers and, no cameras to at least you had a couple questions about people who, are getting Zoom fatigue. Everybody on this call is probably going to have Zoom fatigue by the end of the day, just to let you know. But can you guys address some of the issues that everybody's facing, whether it's trying to get our members up to speed on Zoom or technology, or how to, get them the technology and train them. So I'll let you guys all talk.
I spoke a little bit about our tech team, but we did, when COVID came in and shelter in place happened, we did make another leap in terms of our tech support that we provide, because before it was always volunteers going to people's homes. It was a great way to connect and all that stuff. But given that that wasn't able to happen, we created understandings and actually created waivers with our volunteers who are providing tech support to be able to access, to be working online with our members, but to be able to have the access to their computers, so they could get access to a member's computer and make the changes through their own computer from afar. And that was done again through DocuSign, et cetera. So, but that is for the higher tech. For people, we did trainings with the Zoom. And then it was just Q&A, when people would have questions, they would get a response. We would send it out to our volunteers. For people who are less than equipped in terms of technology, it's difficult, really. There's the Zoom call-in. And so we've had people just calling into our events. So that's my response.
And I would say we had some really excellent early adopters within our membership. And so we would start programs a little bit early and all talk about questions. We also did, one-on-one trainings, and we put together video trainings as well as PowerPoint trainings. But actually at the beginning of each session, when people could really ask you questions prior to the presenter getting on, it really helped to have even other people answering in addition to staff. So people kind of learn that way. And in terms of Zoom fatigue, that question, when we started out, we were really doing presentations where we'd have a speaker and they'd go through their slides, and then we'd go to question and answers maybe midway between the presentation and at the end. And now that we're getting a little bit more comfortable with the format, we're really trying to work in breakout sessions, polling questions as we did today, as well as really creating interactive activities that you can do online. So our members have been getting really creative and wanting the programs to continue to get elevated as we go.
Terrific. So we did have a couple of questions that somebody asked. Just shoot it out there real fast, boom, boom, boom. Your average fees for your membership.
At Arlington, our full members are $500, families are $750. And as I said, financial aid pays 80% of the membership fee.
Ours are single members are $650 and dual members are $1,100.
Ashby $750 and $1,200, and we have not raised them in 10 years.
Elise, your attendance in virtual events is very impressive. What is the average age of your participant, and are your attendance rates declining? Is winter going to take another sub question is we're looking at the winter months and the holidays. Can you all expand on how you're combating that and what you're looking towards to do as we face the next couple months?
In regards to average age, I don't really have a true number because 50% of our membership hasn't shared their age with us. But I would say we have a real range of people that are on Zoom, and we have people in their 80s, pushing 90. So we have a wide range of people using Zoom. For the winter months, we are really trying hard to have a larger variety of programs, not just speakers, but entertainment, more member-led programs, more social programs, just to keep interest going. We saw a slight dip in attendance in the month of July, or pardon me, in the month of August, because it was really nice in Minneapolis, but we think we're going to have a larger attendance actually for Minneapolis just because of the weather going forward.
Barbara, I know we're close to the end of our session, but
we are.
One of the things I wanted to mention that's happening here in the DC area is that villages are sharing their scheduled Zoom events with each other. So where there's a challenge on any one village to come up with great speakers all the time, what we're doing is letting each other know about our scheduled events, and we're advertising, promoting them within our network, so that we're essentially creating a larger village community, so that we can all share in good speakers that have been identified and get people to participate.
I hate to cut you all off, but we do need a break, and we do have a lot more to cover. The one good news is that we have, the network has agreed to do another webinar, COVID related and more interactive, not just this, but a meeting style where we can have an interaction, a Q&A. So we hope to do that within the next 6 weeks before the holidays. So thank you all. We appreciate your time, and stay well, stay healthy. And we're going to turn it over now and introduce our sponsor spotlight, and we will have a 15-minute break during this time period. I'd like to introduce Mark Ash. He is with Right at Home, and welcome him to our conversation. Mark, are you there?
Yes, absolutely, right here.
There you go.
Good afternoon, good morning, if you're on the West Coast. And thank you, Barbara, for the honor of presenting at this National Virtual Village Gathering, and welcome you all. I am with Right at Home, and I'll be sharing a brief PowerPoint, and it is indeed an honor to be here. Right at Home, we are actually a national, actually international company. We have more than 500 privately owned and operated franchises around the United States, and we're in several other countries as well. And we really can be a great resource for the villages, and I'll talk about that as I go through. Each franchise is locally owned and operated by a proud family that's engaged in serving their community and actively involved in responsive leadership. Each of our franchises is a 24/7, 365-day-a-year organization. And as I speak throughout, we answer our phones locally, and each community will have a local representation. The franchise that I represent serves Prince George's County, Montgomery County, and parts of Baltimore County and City. And can everyone see my screen?
Mm-hmm. Yes.
I'm running it for you, Mark. I'm running it for you.
Just making sure. Thank you.
Yeah.
So we provide caregivers to go into the client's home and provide non-medical home care to assist that client at their level of need. And that level of need could be episodic, where they've had an operation or something of that nature, or it could be ongoing care and support if they need additional help in the home. We want to help people stay safe and continue to thrive in the home. We serve anyone that's 18 and over, and again, could be episodic, or it could be ongoing care. Our caregivers are properly vetted and trained, bonded and insured employees of our agency in every case. They go through a national criminal background screening, work history verification, drug screening, health screening. We want to make sure that if we serve your community or your village, that the caregivers that come into that community are safe and appropriate to serve the needs of the community that we serve. All of our caregivers are trained by our registered nurse and are managed by a registered nurse in our agent, in our each agency. We provide, in the simple sense, non-medical home care at the client's level of need. Non-medical care is always care that a physician does not write a medical order for. The levels of care are always determined by each client's abilities regarding the activities of daily living, eating, bathing, dressing, toileting, and mobility. And in the simple sense, we provide 4 levels of care. I'm not going to go into the detail of each level of care, but I have provided that in the slides, which you'll be able to carry with you. Those simple levels of care are companion care. Companion care is when a client doesn't need any kind of hands-on assistance. And the companion care is described in the next slide. We also provide personal care. Personal care is when the aide is providing hands-on assistance with the hygiene, with bathing, dressing, toileting, mobility, and so on. If a client can't take their medications, we can provide assistance with medication and provide a med tech. And then in our particular franchise, we actually can provide some skilled nursing services, which would be help with G-tubes, help with wound care, help with setting up someone's medication if they're coming home from the hospital or from a skilled nursing stay. They may need assistance in medication administration and medication monitoring. And those are some of the things that we can assist with. So as I mentioned, and here's what companion care is. I'm not going to go into each thing. Some of the things, as I've been hearing throughout, is in your villages, you are helping clients live optimally. And that is where home care can really step in and assist in that regard when a neighbor can't provide care, up beyond a certain point. That's where a home care agency could step in. So as I mentioned, I've described companion care here. On the next slide, when personal care is appropriate. And then when a client requires a med tech, in our area, in Maryland, a med tech is someone who has received a geriatric nursing assistant license, and then they go through an additional medication course, which allows them to pass medication under the supervision of the registered nurse. So it's important that we're providing the right care at each level of need. And in the case of when we step up a level of care, we still provide the other services that are described in the other levels. So if someone starts at the companion level of care, they're only receiving the companion chore services. If they move to the personal care level, they are also receiving the companion level of services. And if they go to the med tech level, they're going to receive the personal care and the companion chore services as well. So in every case, it's always designed to meet each person. And if the needs change, we can change the levels of care. And here on this slide, I've described what skilled nursing services are that we can provide. And again, your local agency may vary in the level of care based on their licensure. The franchise that I represent, we are a residential service agency level 3, which means we can provide skilled services. Now, these are some of the services where we can become specialized. Of course, in dementia care, we have programs specific, and our caregivers are trained to work with folks with dementia. Working through any of the arthritis difficulties, if you will, our caregivers are trained to help and assist in each area. Hypertension, stroke recovery, these are areas where it's one of our most common care, most common levels of care that we provide is assisting after a stroke. Diabetes, heart disease, again, I don't need to go through each one, but as you see, we can develop specific programs to meet the level and the need of each individual. Some of the things I do want to touch on is hospice support. There may be a client that lives in the community that receives a diagnosis that could be considered terminal, and we can work with a hospice agency and provide that supportive type of care to keep that client thriving at home. So as you see, there could be different levels of need in each community, and we can meet that community and that individual at their level of need. COVID-19, of course, that's the big topic. All of our caregivers are screened either on a weekly, bi-weekly, or monthly basis. Each franchise may be doing it a little bit differently. We require screening as part of employment. A caregiver must be screened and healthy in order to serve our clients in the community. Our caregivers will quarantine if they're tested positive, will never be sent to a client's home with any kind of health issue. If a client is positive for COVID-19, we can serve that client's needs. There will be a dedicated caregiver or dedicated caregivers that will be assigned to that specific client, who will not work with any other clients in their home until the client and the caregivers test negative. So we can help someone during COVID. We just want to make sure that we're keeping everybody safe. And of course, we're going to be doing routine surveillance of a client's health conditions, checking their temperatures and other health issues. And in fact, that's a part of our daily screening of any client. We review their health issues and we check their temperature and their ongoing health on a daily basis to keep them thriving at home. All of our caregivers are issued and trained to use protective equipment to, of course, protect the clients, the families, and keep the caregivers safe as well. The safety of our clients and our caregivers is always critical. We take that very seriously. We focus on the human connection. Again, we screen potential employees to make sure that we choose the person that has the heart for caregiving as best we can. I mentioned the screening earlier. In fact, for our caregivers that drive clients in the community, we screen their driving record every single year to make sure that they have a clean driving record. We do the health screening, as I mentioned, the TB testing, history, the work history verification, and we train our caregivers to meet the special needs of our clients at their level of need. Caregivers are also trained to, we have specific caregivers that will work with clients that are on hospice. So, you know, that requires a special kind of heart, if you will, and it's important that we match a client and caregiver appropriately. We actually meet with the client families or the client themselves and understand their needs and preferences and what they're looking for in a caregiver, and we match the caregiver to that client's needs after a detailed assessment. As I mentioned earlier, every franchise is locally owned and operated. Our phones are answered by employees of our agency. We don't have a call center. We don't have a central call center. Each office answers the phone locally, and we can provide immediate care and support to help a family. And we can usually staff a case within 24 hours if a client and family needs that. Our community liaisons sit down with each client family and understand the care and support needs as they are, and develop a care plan along with the nurse to help that person stay safe. We use a program called Clear Care, which our families have access to, which they can use as a communication tool. And they can also see care and support notes and enter notes themselves. So it's a great tool, and it's a great way for clients that are for family members that are at a distance to be able to see what's going on with their loved one and make sure that the right care is being provided. We champion ways to make home care affordable. We all know that in most cases, your medical insurance doesn't cover your non-medical home care. So we do offer private pay. We offer flexibility of hours with no weekly minimum. So it could be 2 hours a week. It could be 2 hours a month. It just depends on the needs of that client. Non-medical home care is also paid for through long-term care insurance. It's paid for through a variety of different veterans programs. In our office, we specifically are an approved vendor under the VA, and veterans could qualify for a program called the Homemaker Program. So we try to find resources that may be available to help an individual. Workers' compensation or auto insurance could also pay in the event that that person is involved in an accident or a situation at work where they need extra care and support. A person could use their flexible spending accounts or reverse mortgages also to pay for non-medical home care.
Mark, we're going to have to finish up here.
I'm going to wrap it up right now with this slide.
Oh, sure.
And that is, how can Right at Home serve the villages? We can design a specific plan for each village community. We can designate specific caregivers that understand the community and minimize the number of people coming into the community. We can provide professional caregivers so you can maintain a relationship. There's some aspects of care that you don't want to provide for your neighbor. We can provide transportation and other services on a contractual basis, and we can provide preferred pricing to benefit the community. And why Right at Home? These are the things that I've just described as I've gone through. I appreciate the opportunity, and I always welcome any conversation. My contact is in the slide, and I thank you again for allowing me the opportunity to present.
Well, thank you very much, Mark. Everyone is, you've got lots of chatter in there, and I think Steve shared your email, so we appreciate your time. And we're going to thank you. We're going to turn it over to our next panel discussion, Villages and Age-Friendly Communities, Paths of Intersection. I'd like to.
Yeah, I want to get our panel members if.
Sure, we have, I just pulled Melissa over. Danielle Argoni, Judy Zimmerman, Heidi Weir.
Yeah, so if you guys just raise your hand, that's going to be the, there we go. I got Danielle. And let's see. And I guess.
Judy Zimmerman,
Yeah, I'm getting them over. Sorry.
Okay, no problem. So I'm just going to start introducing. Melissa is the Executive Director of Lancaster Downtowners. So we welcome you, Melissa. Danielle has been a great supporter of the Village Movement. We enjoy, she's with ARP. She's the Director of Livable Communities. We have Judy Zimmerman, and Heidi Weir is the Chairman of Swampscott for All Ages, which is a developing village. So we welcome you guys. Look forward to hearing what you have to say. And I'll turn it over to you, Melissa, or Danielle. I don't know who's taking off first.
All right, Danielle is going to kick us off. I don't see her yet.
I'm here.
Okay.
I'm going to try and share my screen. Let me know when that pops up.
Looks good.
You're up.
Yep.
Excellent.
Thanks. Well, thanks for having me here. I'll confess my computer's doing some funny things. So I'm really hoping that it cooperates. But I'm really happy to be here. Barbara, thanks for the invitation. And it's been really a joy to meet Wendy and Melissa in this process. And I'm excited because whereas, here in ARP, Livable Communities, we talk a lot about sort of the value of our program and sort of the value of the age-friendly approach. And we've nominally touched on the sort of connections between villages. Today is really all about exactly where those two things collide in really productive ways. So I think the genesis of this sort of conversation began with I think Melissa's idea to look at both a village that identified the value of also having their community join the ARP network of age-friendly streets and communities. And then to couple that with the reverse, which is a community that was already in the ARP network of age-friendly streets and communities, and the value within that of building out a village to augment and to deliver on some of the services and priorities that they had identified. So so that's what we'll hear from in this sort of the remainder 2/3 of the presentation. But I want to kind of take a few minutes just to present a little bit of an overview to launch that conversation. So I'm going to hope that when I advance my slides, it actually advances what you see too. So what we see here, and this is just a real quick overview in terms of what we do here in ARP, why we do what we do. I've had the good fortune to present to you all before, so hopefully this is old hat by now. You've heard from my colleague Karen Cafanteris last week on Home Fit, and you've heard from my other colleague Aisha Padilla a couple weeks ago on partnerships. But really, we're very much motivated by this idea that we as a country are changing, and that by 2035, actually it's 2034 now, it'll be the first time in our country's history when we'll be comprised of more people than we will of people under 18, more older people than we will of children under 18. And that causes us, of course, to really examine our built environment and to make sure that it works for that generational shift that we're in the midst of. And we've really concluded that for the most part, it doesn't actually, that we see when you look at housing, that there are a number of mismatches between the kind of housing stock that we have available and who we are as households. Over half of all households are 1 or 2 person households, and yet more than 85% of our housing stock is significantly oversized for that audience. We also see that the rent burden ratio, particularly among older renters, is really increasing. So people are spending more of their limited fixed incomes on rent than they have in past years. And we see that there's this huge lack of the right kind of supply of housing, whether it's universal design or other features, accessibility features that would allow for people to age in place well. We see that people outlive their ability to drive when we think about transportation by anywhere from 7 to 10 years. And so that day when the keys get taken away really can mean a very precipitous drop off in terms of access and mobility unless there are transportation options available to them. We also see that older adults represent a hugely disproportionate share of pedestrian fatalities in 35 states. So even when folks can get out and do walk, it's not safe necessarily for them to do so. We see that there's a real mismatch between who lives in communities and the degree to, particularly around parks, and who uses those parks. And we also see that some communities are less well served by parks overall, which can lead to increased temperatures, which again disproportionately impacts older adults who suffer more from urban heat island effect and heat related deaths. And then finally, all of those things contribute to a sense of prolonged isolation and loneliness it's a byproduct of the built environment. It's not uniquely driven by that, but the built environment really shapes that and reinforces that. And I think we've all had a taste of that, certainly in the days of COVID, but we know that for older adults, prolonged isolation has really very acute health effects, not unlike smoking 15 cigarettes a day, and that actually even increases the risk of dementia. All of which is to say that that's why ARP cares about communities. That's why we see value in working in communities to help them improve their housing, their transportation, and their public spaces to make sure that they are great places for people of all ages. It's very much grounded in what older adults want. We know that older adults want to be able to age in their home and in their community. Well over 3/4 of people 50 and above say that they do. We also see that villages have a really important role in that. So when we asked people a couple of years ago what their preferences were for their home and their community, about more than half expressed an interest in joining a village and were willing to pay a fee. But there was a real lack of understanding, I think, about how that fits in, what sort of services that could provide for them, and how that might enable them to better remain in their home. I did want to sort of tee up an example that what's your appetite for this intersection. So one of the members of our age-friendly community, which I'll describe in a second, San Diego County, has already sort of illustrated the benefit, I think, of leveraging the pillars of strong village and strong age-friendly commitment. So this particular jurisdiction, San Diego County, has had an action plan in place for a couple of years now. And one village, Tierra Santa, is part of the advisory group that is also including folks from the San Diego Senior Alliance and Village Movement in California as part of that sort of core committee that's driving the age-friendly work as a whole. And the action plan that San Diego County is working on focuses on villages in two respects. One, it's looking to assemble and create more educational information about villages and co-ops so that people understand what the opportunity is, and also incorporating dementia-friendly concepts into the training for new village organizations, staff, and volunteers. And then to the degree that villages play a hugely important role in transportation, the community has also identified that they want to work with community partners to pilot new approaches in transportation, such as village style rideshare programs, member-driven rideshare programs. And they really do actually have a very specific goal of increasing the number of 50+ households that are able to use and access village community support systems. So I think that's such a great illustration that you'll hear more about in the two communities we'll hear from today. So again, just a real quick overview of what our age-friendly community program is, and what it does is it rests on these 8 domains of livability that really speak to not only the built environment, housing, transportation, public spaces, but all of these other elements that really comprise our social environment that make communities work well. To what degree are people getting information, communication in the way they need it? How involved are people in civic life or in the employment sector? How much are older adults sort of respected and included in social activities? To what degree does the community foster access to health and well-being? And what kind of activities, community-wide activities are available and offered to older adults to be sort of socially active? Let's see. My computer seems to have frozen. There we go. There are almost 500 communities across the country now that have joined our age-friendly network, including San Diego County that I just spoke of, and including the communities that you'll hear about shortly. Several of these, many of these are quite small. About a quarter to a third are rural or small town communities. We also have 6 states that have signed on as members of the network, which really expresses, I think, a very strong level of commitment at the state level. One of the great things about the age-friendly model is it is voluntary. It's also very flexible. So again, it can sort of do what the community needs it to do. It can be tailored to the unique needs and priorities of the community. And it works over a 5-year cycle. So this is not a kind of one and done effort. It's not a quick checkbox exercise. It's a really meaningful way to affect systems change in a community. We're really happy to say that over 100 million residents currently live in a community that's working to become more age friendly. And we now have a map that's up and running that you can search for in your community to see if there's an age friendly community near you. You can go to livablemap.aarp.org. So the process, again, I've made reference to it. It's a 5-year process. It begins with assessing communities' needs. It moves into developing an action plan based on those needs. And then the last 3 years of it are really all about implementing the plan and then sort of measuring progress and reporting out on that progress. And the champions can come from any number of sectors. They can come from villages, as we'll hear later, in the form of community residents or other nonprofit organizations. They can come from elected officials. They can come from the county department or the state departments or regional planning or transportation agencies. They come from all sectors. And these same sort of mix of stakeholders are often reflected in that sort of core team that I made reference to before. And I think one of the things that we've sought to do is really support age-friendly communities to have all the support that they might need over the course of their age-friendly work. So it is a 5-year process. It is kind of an intensive one. There are no funds that come with this, but we do try to make it as easy as possible by developing online surveys and having a lot of digital training modules available, and as well as publications that can be requested so that a community can move through with all the support that they need. And I think one of the most meaningful ways in which we do that is really by connecting age-friendly communities to one another, allowing them to really network. We talk about it as putting the network back in the network. We want communities to be able to learn from one another and exchange ideas so that someone who's looking to get a village started might be able to pick up the phone and call their colleagues in San Diego County and understand how that fit in and how that's working. Very briefly, I mean, I think it'd be remiss for me not to mention the impact of COVID-19 on our program specifically. I think you all, better than me even, certainly understand, being so close to service provision to older adults, understand the impact that COVID-19 has had on older adults. particularly, with the incredibly dismal fatality rates in nursing facilities and congregate living facilities, and the degree which it's been just really disproportionately impacting communities of color, people of color, and those with underlying health conditions. And all the sort of trickle down effects or sort of other corollary effects that don't get talked about as much, but I think are really worth flagging, in part because they can be addressed in age-friendly work, and they are being addressed in many cases in our age-friendly work. So, older adults have been sort of impacted by the realities that there are very few housing alternatives in communities if they want to move out of a congregate living facility, or if they're looking to get more support or move closer to family. There just aren't the kind of housing options perhaps that are needed in community that might allow for that. We've seen prolonged isolation from family and friends, of course. We've seen layoffs and a lack of reemployment of older adults when economies are opening back up. Obviously, we've seen a lack of access to healthy food and to medicine, limited opportunities for social engagement and volunteering, delays in getting the kind of healthcare that people need because of fear of exposure or because of lack of transportation. We see those transportation options decline when volunteer driver programs have to pull back, or when bus service declines or radically diminishes. We've seen less support and relief for caregivers. And we've definitely seen this very uneven access in terms of access to online resources, particularly for those who lack high-speed internet access in the home or who lack smartphones, of which there are still many. So these are all really important, I think, elements that have been sort of laid bare by COVID that are now on everyone's radar screen to varying degrees. And they are things that we are seeing our age-friendly communities recognize and really double down their work in some cases on, and in other cases, our age-friendly communities that hadn't been working on employment, for example, or access to healthy food, going forward, they are more likely to do that, is what we've learned in a recent survey. So all of these things kind of fit in that age-friendly network, that age-friendly framework that I described, very much so. We did survey across sort of our age-friendly community members to understand how they are taking action on these various domains in light of COVID-19. And we saw a whole range of things, everything from sort of, efforts to utilize outdoor spaces differently by, for example, closing streets to motor vehicle traffic so that people can walk or bike safely in closed streets, or to automate crossing signals so that people don't need to touch the button in order to cross safely. We've seen, friendly voice programs get kicked off and be running steadily since March if they didn't already exist before. We've seen things like advocacy for protection against evictions under the housing domain, and things like increased paratransit services under transportation for those who might be unable to access transportation in the way they typically have been able to. So a lot of really creative approaches within our age-friendly network in response to COVID, but there's still a lot of work to do. So certainly we learned, particularly in COVID, that there were three really big issues that our age-friendly communities were reconciling with. Access to information absolutely was one of the most important ones. Access to food and keeping older adults active and engaged in civic life. That when we sort of took the pulse of our age-friendly community members back in May and June, and then reinforced this with the survey in July, those were certainly the top three areas of focus for our age-friendly communities. So we've been able to harvest some really great examples of how communities have creatively addressed those challenges. And I would invite you to check out those stories. They're sort of first-person narratives. Check out those stories on aarp.org/livable. At the top of our navigation bar, there's a button on COVID, and you can find those stories there. Those stories have also populated a new website that the National League of Cities has launched in tandem with us, which is called our Older Adult Response Initiative, where we've kind of seeded their database with some of these stories and invited communities to share their own creative solutions in order to, as to how they've responded to older adults in COVID. Very briefly, I wanted to just touch on another one of our programs that's been, I think, very important and helpful to communities on their journey to become better places for people of all ages, and that's our Community Challenge Grant Program. So this is where we make small, quick action grants in communities in order to demonstrate change of the type that we really celebrate and seek. So whether that's things like benches in the community or bike lanes or public art or activation of parks and public spaces to make them more safe and inclusive. We've seen really creative solutions be put forward by communities and get funded by AARP over the last 4 years. Again, you can find out if some of those grants have been awarded in your community by looking at our livablemap.aarp.org. A couple other tools to leave you with before I turn it over to my colleagues here. Hope that you all are already familiar with these. If not, this is just a quick reminder. We have a wonderful livability index tool, which allows you to sort of quickly assess the livability of your community. If you're thinking about taking your village experience and moving that into the age-friendly world, you can start with the livability index to figure out where your community is doing well and what are some areas that might be important to focus on right out of the gate. Our livable map, I've already talked about our searchable map. And then certainly I hope that you all are already receiving our newsletter, which comes out usually every Wednesday and features really wonderful practitioner focused content to help you be involved in that kind of community making process, whether it's around housing or transportation or public spaces, or frankly, just sort of getting older adults back front and center in the eyes of local leaders to make sure that they are being thought about, their needs are being addressed, and that they are active part of decision-making processes. So encourage you to sign up for that newsletter. You can text livable to 50757. And then we have a whole library of free publications that you can request and download at your leisure on every topic just about that you can imagine, everything from rural livability, if you happen to live and work in a small town, to housing, where we kind of have some wonderful, very visual guides of what housing alternatives look like in communities, as well as a deep dive on accessory dwelling units, which is another name for sort of typical in-law units or cottage homes, those kinds of things. We have a couple of housing related documents to that end. We have a couple guides on parks and on placemaking. So if you're thinking about how to activate those public spaces and help them to work better, we have some guides for you. And then whether or not you're out walking in your community as a group or individually, we're always really keen on making sure that people are aware of how they can make their community a more pedestrian safe environment. And so we've taken our walk audit toolkit that has been very popular for many years. And we have turned that into worksheets that you can print off at home and use in your community as you do your work, as you do your walks. And then I'll just do a quick plug. I think you heard a lot about this last week, but our Home Fit Guide has been re-released. It's been new and updated. This is a guide with more than 100 tips to make your home, to make anyone's home more age-friendly, make it a better place to age in. And this year, what we are doing is including a lot more information on smart home tech, as well as we really worked very hard to make it a much more inclusive document in terms of whether you own or whether you rent, whether you live in an apartment or live in a single family detached or a townhouse. And we also tried to make it more inclusive of different cultural traditions as well. So encourage you to check that out. Again, all of these documents can be downloaded or requested from aarp.org/livable. So as we pivot over into hearing about the good work of folks at the front lines there in villages, I want to leave you with a couple ideas, I guess, on how to sort of contemplate the role that you currently lead in your village. And I would say if you're working on things like home maintenance and light repairs, might encourage you to check out that Home Fit Guide that I mentioned, or our Here to Stay resources, which come out of our foundation, in terms of being able to identify resources and strategies to make homes more age-friendly. We've seen the huge crisis around affordable housing with COVID-19, and of course, that invites all of us really to really advocate for more diverse and affordable housing across the board. In transportations, I mentioned our walk audits. We've done things through our Community Challenge Grant program, like teaching people how to use rideshare, or doing lessons on bikes. A lot of people are back on bikes these days, which is a great step forward, I think. As well as, hopefully, I think villages are very well positioned to advocate for public transit and for better bike and ped infrastructure. And then finally, if you're working on health and wellness activities, I really encourage you to think about maybe conducting a parks audit with our parks guide, or supporting or participating in these open streets events to get people out walking safely in community, as well as finding ways to continue to support things like community gardens, which can help address food insecurity, as well as be wonderful community gathering opportunities. So with that, I will end. There's my contact information, but obviously I'll stick around through the entirety so I can hear your questions at the end.
I think it's my turn. Should I share my screen? Let's see, here we are. My name is Heidi Weir, and I am from Swampscott, Massachusetts. And for quick view, Swampscott is on the water, just north of Boston. And if you look across the water here, you can see Boston. Are my slides up? Okay.
Yes.
So Swampscott is a little tiny town. It's 3 square miles. It's a beautiful town that sits on the water. We have 14,000 residents, and we're upper middle class suburbia. We're about 20 minutes from an international airport and anywhere from 20 minutes to an hour and a half to Boston, depending upon what time of day you want to go. We're an old town. We're very densely populated. We have a lot of folks that have been around for Swampscott for a long time, and our aging population is growing extremely fast. And therefore, you can imagine what the concerns are with houses that are, some of them are getting older, and our aging population is having a difficult time concerned about snow and snow removal and social issues, especially today under COVID, but also real estate taxes. People are living here and they're paying more and more of their income to real estate taxes, and it's getting expensive when you're on a fixed income. So for decades, everybody in Swampscott has been focused on where we're going to put the new elementary school or the new football field. And if I think we were in a room together, you would all be nodding that this is the case in a lot of communities. The parents are always concerned about what's going on with their kids and their schools, but who's talking about the seniors? So I've been on the board of the Swampscott Council on Aging for the past few years, and the two main questions that we have of this lifelong resident of Swampscott a ride in the van now that he's moved out of Swampscott into an affordable unit, which is a quarter-mile outside of town. Now, I share these examples with you not to make fun of anything, but it was in fact the case that people were really not focusing on the real issues of our population as they were growing older. We were complaining about the food that was served at the senior center, but what about what else was happening with all the folks in Swampscott? Anyway, so a fellow board member and I started to look around, and all of Danielle's information that she shared about AARP is like so dead on. They just have phenomenal resources that you can access through AARP. And what we did was we went to our board of selectmen, and we secured the support of our select board. And then we also asked the town for funding for a needs assessment. And we were awarded $30,000 for funding this grant through, we hired UMass Boston, the Gerontological Institute at the Center for Social and Demographic Research on Aging. This particular group has completed over 30 assessments of towns and swamps in Massachusetts throughout the state. And so they agreed to take us on, and we started our 9-month needs assessment. During that time, they did huge community forums. Swampscott had the largest turnouts for community forums of any other community of the 30 that UMass Boston has studied so far. They did 4 focus groups, interviewing stakeholders like caregivers or research, religious leaders in the community. And then we also had 8 key informant interviews with leaders in the town. We also sent out a survey to a mail-in survey to all residents over the age of 55 in Swampscott, and it was also posted online. And we had a literature review to look at master plans, et cetera, that the town had undertaken already. And, excuse me, we decided that the study was so expensive, or the whole needs assessment was so expensive, because the survey was very important for us. We wanted to make sure that we had the results, a decent return rate on the surveys, and that we had statistically significant information coming back, so that when the town decided that via survey that we needed a new senior center, then we could back it up with this documentation. And indeed, we had an extremely successful return rate of 33%, and we were thrilled at the outcome. So briefly, some of the survey results we got back were only 17% of our population over 55 actually used the senior center. And then there was quite a significant frustration with neighborhood informal sharing. We don't share well with each other in Swampscott, and I think it's something that we need to work on. But significantly, 85% of the folks in Swampscott do want to stay in their home, and so we had to figure out we're looking at what we can do to make that happen. There's a lot of folks do have access to friends and neighbors to provide transportation, but in fact, 18% still were not able to go to a medical appointment in the past year because of transportation issues. Pretty significant. And then we had a large population that really wanted to volunteer, which was really exciting for us to learn. So these are just a few of the survey results we got back. And so the Swampscott for All Ages Committee was a result of that. What we did was the results that came back, we then held another community forum. And at that forum, the results were shared with the rest of the community. And the Swampscott for All Ages Committee was formed. And over 64 people decided that they wanted to be part of this community to try and work to make Swampscott more aging friendly. And the biggest part of the plan that really stuck out first and foremost was starting a village. At that time, at the end of this particular forum, we became aging friendly, and we also reached our dementia friendly status. And so Swampscott is now on the forefront of both of those particular issues. I just wanted to back up and let's see, where are we? Right, so as I said, the top of our Swampscott for All Aging agenda is this creation of the village. And as Danielle pointed out earlier, the livability domains, there's 8 of them, and the village actually addressed very significantly 6 of those particular areas. From our results that came back specifically on housing, we are really in need of affordable housing. And so Swampscott really does need to spend some energies to build affordable housing. That's not necessarily something a village can do, but a village can certainly look at other things that we can do to help people stay in their homes as long as they possibly can safely. The same goes for transportation. And I think I'm preaching to the choir when I say that villages are specifically designed for social participation and civil engagement, et cetera. The interesting piece we found with our 80-year-old and older was that with the communication, only, over 55% of the folks over 80 get their news from the newspaper. And before the survey, everybody believed that no one was buying the newspaper anymore. But in fact, the newspaper was a huge source of information. And the other biggie was word of mouth, and that people just need a chance to be able to talk and share information with each other. So I want to share for a second about the silver lining. But before I do, let me just back up one second, because when we were talking about the the creation of the village. So we were talking about all these different issues, and then we connected with Dick Elkin. So we became a member, an opportunity member of the village, and Dick Elkin became our mentor. And on March 10th, he joined our committee meeting via Zoom, and he shared with us what the village was. And so we had our Swampscott for All Ages committee of over 60 people sitting while Dick shared what a village was and how a village could help us. And then, of course, within a week, we were all shut down due to COVID. Which leads me to the COVID silver lining, because Pollyanna here needed to find something to say positive about COVID. And one of the things that the whole movement for Swampscott for All Ages did was it really brought to the forefront our needs for caring for our seniors. And we started to learn more and more about what the issues were. So when COVID struck, the town politicians immediately said, what do we need to do for these folks? And so it was via TV, newspaper, the website, the robocalls, everything went out and said, we need help, we need help. And there were so many people just wanting to give of their time. We set up a portal on the town website, and within a day or a week, we had over 200 volunteers signing up saying they want to call, they want to make friendly calls to people, they want to shop, and they want to sew masks. We had over 500 masks within the first few weeks of when we were finally figuring out how to make the mask carefully. And we were just distributing them through the senior center, though the senior center was closed. We were just handing them out through the door or putting them on doorknobs. The other silver lining was that we had other organizations like Rotary and like Elder Act is a senior center, a senior arm of Rotary. And these folks came out and they said that they wanted to help out to try and figure out what we could do to help our seniors. We developed a huge database of everybody over the age of 60 in Swampscott, and we were calling everybody over the age of 60 to see what they needed for food. And we created a food pantry as well to try and help distribute food to folks that needed it in Swampscott. Silver lining is to say that people did come out and they do definitely want to work. And I think when COVID, or when we move into the next phase of the village, I think that these folks will be primed to be tapped to help us out with this movement. So when I called Dick, right around the time the buds started to grow on the trees, I gave Dick Elkin a call because we had been working on these other volunteer efforts. And I called Dick and I said, so when do we get started? And he said, start now, Heidi. And so I gathered some folks from the Swampscott for All Ages group. And then we also gathered two wonderful people from our neighboring town, Marblehead. And we started the Sea Glass Village. And this is kind of the most recent iteration of our logo. We decided on sea glass because we want to be able to reach all the towns on the ocean in the immediate area. So we don't want it to be just Swampscott, but we want it to grow beyond. And we have engaged a sponsor. So we have a church that's willing to sponsor us, and when they will open their doors, then we have an office ready to go and ready to make it all happen. The website is coming up next week, and we have sent in our 501c3 as of last week, and we're incorporated. And so things are going great guns. We're really excited about it. And I think that the biggest, most important piece is that all of this energy that went behind the aging friendly needs assessment and pulling this together just catapulted us towards creating this village. And I think that within a matter of a few more months, we'll be able to really get out there and start providing services. I know that we're really excited to, and I think that there's also a little bit of fear about whether we pull the trigger right now or whether we should wait a few more months to keep it safe. So any advice from all of you would be most appreciated, but that's Swampscott's story in a nutshell, and I look forward to questions later on. Thank you.
Okay, well, I work to share my screen. We're going to start off with Judy Zimmerman Herr, who is the board president for the Lancaster Downtowners.
Hi, yeah. So we just heard about a town that started with age friendly and moved to develop a village. And our story is the other direction. I'm Judy Zimmerman Herr. I'm the president of the board of the Lancaster Downtowners. And the Downtowners started as a village in 2008. We're a group of about 175 urban dwellers centered in the city of Lancaster, Pennsylvania. Lancaster is an old eastern city of row houses with an area of about 4 square miles surrounded by rings of suburbs. And the city itself is very walkable and accessible with many things that retirees look for. Lots of restaurants and art galleries, several performing arts venues, a strong healthcare system. And as you can see, Lancaster was listed in the top 3 best places to retire for the past 3 years by US News and World Reports. Now, the next slide, Melissa. Oops. Do we have it? There we are. So for our first 10 years, the Lancaster Downtowners was an all volunteer run village. And in 2017, the board engaged in a process of strategic planning that led to several changes. One was hiring a part-time executive director, who is Melissa. Another was entering into a collaborative partnership with Landis Communities, which is a continuing care retirement community that's located several miles outside the city, but also operates an apartment building in the city. The partnership provides us with administrative assistance, including HR and payroll functions and some office space. And in joining this together in this partnership, we spent some time researching various entities, and we settled on Landis Communities due to having a sense of shared values and also their strong interest in working together to make Lancaster a good place to grow older. And as part of our partnership, the Downtowners and Landis Communities worked with the city of Lancaster to implement the process of Lancaster becoming an age-friendly city. So the question is, why age-friendly? One of the goals of our strategic plan is to serve as a resource on aging and age-related issues to the wider community. Another goal is to grow our connections with other agencies and organizations in the city. And another is to let more folks know about the treasure that is Lancaster Downtowners. So the age-friendly initiative and our involvement in it respond to all of these goals. So it seemed like a no-brainer. It just made a lot of sense to join that effort. Melissa, you can carry on and talk about how we did it and what we do.
Absolutely. So the idea of age friendly was introduced to Lancaster County actually by a collaboration of Lancaster Area Senior Services, which were the continuing care retirement communities in the county. They saw the value in age friendly and wanted to see if it would be a good fit in Lancaster County. And so they brought in age to age consulting to introduce the concept and see if there might be traction in our geography. Now, in order to join the network, one of the things that you need to do, and this is something to think about if you're a village considering this is that you need to have the, the blessing and the approval and the sign off of the highest political office in your jurisdiction. So for us, there were two options. There were the county commissioners, if the county was to join the network, and there was the mayor and city council if the city was to join the network. And for us in Lancaster, where that really hit home was in the city. The city was ready to say, yes, this is something that makes sense. We had some quick support from the mayor, good support from city council, and then the leadership team, which at that time was and is still Age to Age Consulting, Landis Communities, the Lancaster Downtowners, and then the city worked on the application together to submit to AARP. So that took us to start and now we're in the planning phase. So Lancaster is in year 2 of planning. And we'll talk a little bit more about what has happened over those 2 years and how it's involved the village. So for our environmental and needs assessment, we were able to partner with Millersville University, who had their School of Social Work, and then one of their geography classes do an environmental scan that identified services in the county where they were available. And the results of that scan, the large scale view of it was that there were a lot of things available for older adults in Lancaster County, but the pieces weren't always connecting together. Sometimes it was hard to get to a place, sometimes you didn't know about things. And so that helped identify some of the starting needs that an age-friendly connection and plan should work towards. In having these conversations, some energy was picked up by the United Way of Lancaster County, and they offered to bring all of these services and sectors together in a summit so that we had in the same room folks who were accessing services, folks who were providing services, business folks, people in housing, to come together and talk about things from the lens of a Lancaster for all ages. What would age-friendly Lancaster City and age-friendly Lancaster County look like? So out of that, we were also able to survey, get inputs, and another domain or area that rose to the top was that housing is going to be something that we will need to consider how we can support folks staying in their homes, making sure that homes remain accessible, are priced affordably and attainably. So we learned some of that through the summit. Another thing that we wanted to do was sort of celebrate that we were embarking on this journey, that there was going to be this effort towards focusing on the needs of folks of all generations within our city. And so this is one of the places where the village really came in and hosted the Fete d'Or celebration. We had a proclamation from our state representative. We had representatives from AARP Pennsylvania there. And it was really just a gathering in the city to celebrate the idea of us moving forward and making this a better city for everybody. And then after that, we started embarking on more focus groups because we had some data from the scan, from the summit, from other conversations about what we might need to look towards. But we needed to look to the community as how do we want to do that? So we had started facilitating focus groups and were able to get to our mission statements. And that was, of course, in March, which brings us to COVID times again. But we were able to establish, before the world felt like it turned upside down, what our mission statement would be for age-friendly Lancaster City and what our structure would be. So you can see that what we realized was something that was missing and that we could sustainably bring to the city was a way to connect generations, organizations, and resources to enhance the lives of older adults and ensure an inclusive community where all ages flourish. So as Danielle mentioned, just because you join the age-friendly network does not mean that all of a sudden a lot of money comes flowing towards you. Sometimes it, feels like a little bit of the opposite. We're fundraising on a lot of different levels. And I know folks who are listening to this call understand that if you're involved in a village. And so we knew that what this leadership team could sustainably bring was the ability to connect and to reframe conversations, and to identify where organizations already doing good work could enhance what they're offering by adopting an age-friendly lens. So you can see that's the structure that we have initiated and that we are working on projects with. Okay, so what has been the point of all of this for the downtowners and our village? In addition to what Judy said about it fitting into our history of collaboration, our way of impacting the community, you know, it is a way to extend our mission beyond our membership. When we are getting involved in an initiative like this, we're not just creating a better city for a downtowner, but we're creating a better city for folks who aren't members of downtowners too. And this has been a way that we have been able to increase our input as an organization and as individuals into the policies and programs that the city is doing. Our city is adopting a Vision Zero program, which is to reduce traffic injuries and fatalities. And Lancaster Downtowners was one of the first organizations and individuals called to meet with their team to talk about what were problem intersections, what routes do members and individuals avoid when they're walking downtown. Another way it has brought Lancaster Downtowners into the mind of city staff and organizational staff and brought us into collaborations that we wouldn't necessarily have been thought of to join before. Something that's happening right now is a nonpartisan initiative to help folks register to vote. And so we were able to assist in that effort, and the folks collaborating on that with the YWCA and the city and a lot of other social service agencies. They knew about the downtowners because of our work working towards age-friendly Lancaster City. And then finally, it has put us in the minds of a lot of different city employees so that when an older resident calls to complain about a fine they received because they could not shovel their sidewalk, the city knows that they can refer that resident to the downtowners, who can then be hooked up with a volunteer to help keep their sidewalk clear when it snows. So it's been a source of referrals for us, a source of community connection, and a way to better see the improvements that we want to happen in our community. Yep, here we go. And then, all right. So with everything, there have been some COVID pivots. So over the last 6 months, what Age-Friendly Lancaster City has done to work with this, we were able to collaborate on a COVID-19 impact survey. This was done jointly with Age-Friendly Lancaster City, again, the United Way of Lancaster County, Meals on Wheels, and then the County Office of Aging to see what older adults needed, to see how they were impacted. And the high-level results of that survey is that fewer than we assumed were worried about loss of income, and more were worried about loneliness and depression. And so that could help carve some of our responses and time spent. One of the ways that came about to help engage that and provide that purpose and provide an avenue for connection is that with the switch to virtual school and with many village members and other residents, older residents in Lancaster learning Zoom, we could begin to match students with Z-tutors to get some focused attention. I am the parent of a first grader, and in watching her interact with her teachers and the wonderful educators, can see that she is still missing that one-on-one interaction And what the volunteers are able to provide is concentrated 20 minutes, because that's about the attention span that you can get out of an elementary school child, of focused attention on them and reading support in a way that supports the student, in a way that supports the families, in a way that supports the teachers. And we were able to do that because we were looking at this from a multi-generational perspective, from an age-friendly perspective. And then, yeah, so we will also have an age-friendly Lancaster Summit 2.0. That'll be coming up virtually in December. And the theme of that summit is connecting generations through COVID. And it will be a design process that will bring together, again, organizations and individuals for the purpose of thinking about how different generations can support one another as we make it through this pandemic. So that is where we are at this point. Looks like we have about 5 minutes for questions.
I'm right here.
All right.
So that's excellent, guys. Very nice. I will ask each of you to please put your contact information in the chat room. There were some questions which were answered in the chat room, but we do have somebody that has their hand raised. Laurie, did you want to ask your question? Laurie Pross, I just pulled you over. Can you unmute your mic?
I actually didn't have anything to say for a change. I'm sorry.
Oh, okay. And no, you had your hand raised. No problem.
Okay.
No
Sorry,
problem.
and something else. I'm sorry.
Not a problem. Thanks. So we have a couple of new messages. Oh no, that's yours, Diane. Danielle and Judy put their contact information. This has been very super useful. Danielle's comments and having villages, we hear at both ends, villages starting with them being age friendly and then villages promoting, on the other end, so we've heard examples of both, which is great. And I think there's a lot of information that, especially like the community grant challenges that Danielle talked about. And if you didn't catch it, the Home Fit, which was last week, which is a whole new level and a great new toolkit, which we'll be putting on our website. Any last thoughts, Danielle, Heidi, Judy, Melissa?
Well, actually, I was going to say, Barbara, I was just typing you a note. If we have a couple minutes, I have a couple more slides I could show about what we learned from age-friendly communities in their response to COVID, if that would be of interest to people.
Yeah, let's do it. Bang it out. That's
all right.
Great.
Sorry to circle back here. Let me see if I can get my PowerPoint back up. Hopefully, yeah, okay. And I kind of left this to the side just in case we had time. I didn't want to take away from anyone else. But one of the things that we did this, as I mentioned, we did a kind of a quick survey of our age-friendly community members in July. They've been sort of working on response for a little while. We wanted to kind of understand from them how our hypothesis, which I think we bore out, was that communities that were already working on age-friendly efforts were better positioned to respond to COVID-19. And so we asked them some questions around that. So we kind of confirmed who they are, where they are. About 50% are urban or suburban, about 40% are small town or rural. We confirmed who some of the leaders are. I talked about that previously: government agencies, volunteers, councils on aging, and the like. We asked, to what degree do you feel like your community has been impacted by COVID-19? We have members in all 50 states in all kinds of contexts. So there's a real range in terms of how much COVID had an impact. I think the answers would be different now still, but the vast majority of communities said that to a moderate or great extent it had been impacted by COVID-19. And we asked the question, do you feel like your age-friendly work has prepared you to respond to COVID-19? More than half said yes. About a third said they're not sure, because some of these were very early on in the process. We've had about 150 communities join in the last year. So they were still very early on in the process and not quite sure. And others said no, they didn't think it helped that's for another day. But one of the things I think we're particularly interesting was to what degree was the age-friendly work helpful? And the vast majority, the strongest answer was certainly around partnerships. And I think you heard this from the presenters today, that it's those partnerships among diverse organizations that are already in place by virtue of the age-friendly work that really can be helpful in times of crisis, particularly like around COVID. We also heard that prior efforts to improve communication with residents, such as understanding that they read the newspaper, for example, really paid dividends in terms of needing to get information out to people in times of crisis. Similarly, prior efforts to understand their needs. We heard Melissa talk about the importance of housing. Understanding community residents' needs before crisis hits makes it easier to respond. And then we also heard about volunteers and the incredible interest of people to serve as volunteers and to help older adults. Age-friendly efforts already oftentimes had volunteers kind of in the wings, if you will, who were available and could be deployed to help. So we'll go into detail here on this slide. What this really kind of summarizes those big 3 items that I talked about. Age-friendly members said that information, access to food and health care, and civic engagement, social engagement were really very important. But there are a few things that I do want to highlight. One of the highlights is the fact that many of our age-friendly communities had not been working on emergencies and disaster preparedness before. Less than half of them had been, but about 75, well over 75 or 80% said that it was going to be important in their recovery going forward. Similarly, less than half were working on local businesses and economic development, economic activity. More than 80% said that that was going to be something that they would need to think about as they looked to recovery from COVID. And then a final note on the importance of congregate living facilities. Very few had been working on that prior. Many were going to in the future. And similarly on equity, less than half had been working on that prior, but well over 80% said that that was going to be important to work on going forward. All told, the sort of punchline here is that around two-thirds said that they do believe that their community's experience with COVID will change their age-friendly approach. And many of them talked about some of those issues, focusing on the need to focus on isolation, the need to focus on equity, the need to focus on disparities in access to broadband and internet, the needs to improve communication channels, and the need to identify secure food sources and the like. So that's just a little very, very quick overview of what we learned from our age-friendly community members who sort of lived through the COVID experience and how it's going to change their approach going forward.
Well, thank you all. This has been great. I know we're out of time, but I appreciate everybody's presentation and comments, and we promised we will share everything at the conclusion of our conference. Just give us a day to recover, okay? Thank you. Next up, we have a presentation from Vitality Society. And rather than me going into Meredith's bio, I'm going to introduce you to Meredith and have her come on and she'll tell you about some of her achievements. I think you're going to be very interested in hearing from Meredith and Seal Garrett and others that are participating in this program. So Meredith, take it away.
Can I not be seen? This is interesting. Hold on 1 second.
We see you. We see your logo.
Yeah. Why is that, I wonder? Hold on 1 sec. Oh, there I am. Okay. I have a young child. You closed my camera. So wonderful. Juxtaposition, young child, older people. What a treat to be here. Barbara, thank you so very much. I want to share one anecdote about the closed camera. We launched Vitality Society January of 2020. And prior to doing so, when I was building the platform, I worked with a consultant to build the platform, and she said, we're going to use Zoom. This was like August 2019. And I said, I never heard of that. And she showed me how to use it, and I loved it. And when we launched in January, I spent pretty much the first few weeks teaching everybody how to use the audio and the visual. And one woman we weren't able to help, and we saw this beautiful illumination around her. And I said to her for a moment, I was like, is there something that, let's try another button. We were going through every button that Zoom had. And my daughter walked by and she said, Mama, she said, I don't think she took the sticker off the camera. and she peeled away the sticker, and that began the beginning of Vitality Society and the use of Zoom. So I always think about that. And here we are today. I did the same thing. The joke is on me. So, well, thank you so much. We have a full program today, and what we're going to start with is a representation of what we do on Vitality Societies.